Okay, start. Hello, good morning. Good morning, everybody. Good morning. Good morning. क्या बोलते हैं? सुबह रात्रि. शुभ शुभ रात्रि या सुबह रात्रि, आई डोंट नो. गुड मॉर्निंग. कैसा है जोश? कैसा है जोश? आई थिंक many people are not up in the morning. How am I? I am very Ratri means night, right? Yeah, Suprabhat. Yeah, Suprabhat. Yeah, so the josh is very like सुबह सुबह ठंडा पानी नहीं होता यार मुझसे. आई एम टू ओल्ड बाय नाउ. हाँ, तो आई डोंट लाइक वेकिंग अप अर्ली इन विंटर्स. ठीक है, विंटर्स इज नॉट माय थिंग. तो कौन से नशे किए थे? बस इट्स जस्ट दैट इट्स मॉर्निंग. ठीक है, मॉर्निंग नहीं होता मुझसे. हाँ, सो ऐसा होता है ना. सी, इफ यू आर लाइक इट्स दिल्ली एंड इट्स वेरी कोल्ड. ओके, सो इफ यू आर लिविंग विथ समबडी या यू मैरिड, कोल्ड इज गुड. लाइक सुबह सुबह उठने का मजा कुछ और होगा, बिकॉज यू विल बी, यू नो, देयर विल बी नेचुरल हीट. पर अब सूखे पड़े लोगों का सुबह कैसा होता है? Yeah, thank you so much. Good morning. Good morning. You all, so I made it for you. See, I got up in the morning, I came. नहीं, इतना जल्दी जल्दी नशा कौन करता है? पर you made me get up in the morning. वरना मैं, I think 10, till 10, I will not wake up. 10:30 I'll wake up. एग्जाम भी तो सुबह है ना मैम. हाँ, आपका ना. आपका एग्जाम है ना सुबह. ठीक है, बेस्ट इन द वर्ल्ड, आपको ज्यादा पता है. राइट, let's continue. So you remember we ended up with this question. All right, so let's start our questions. Let's do as much as possible. And we ended up with this, which was celiac disease, and it was what? Gluten sensitivity. Okay, it was gluten sensitivity. And what was that? What was the antibody in it? You remember? It was transglutaminase antibody plus endomycin, right? वही अल्टीमेटली. सी, इतना सब अपनी मतलब मेहनत कर रहे हैं ताकि यू पास. ओके, सो यू पास, कम टू अस, बोलना कि मैम आपको उठाया था सुबह, आपके साथ हम भी उठे थे, एंड वी डिड इट. Okay, so that matters more than anything else. So that's good. And I'm glad that you came in the class. You are here in the morning. Which subjects will I be covering? It will be a mixed bag. ठीक है, तो हमेशा mixed bag था, अभी भी mixed bag होगा. Maybe next time when I take in YouTube, I will do subject wise. But I did it very late ना. तो आज 18 है, 20 को आपका एग्जाम है. तो yeah. No, it's okay. That sleep is nothing. Okay, I feel very good. The minute I got up, it was fine. Like I remembered कि class है तो ऐसा है. Okay, so celiac disease, again remember what are the antibodies. So epidermal transglutaminase plus on biopsy, what do you see? What do you see on biopsy? Villus atrophy plus hyper Crips, right? Crips. And then what is the extraintestinal manifestation? Yes, it is dermatitis herpetiformis. ठीक है, तो now look at this image. ये तो सबको पता होना चाहिए. black body black body, white shoulder, right? super प्रभात. अरे यार, sorry. Good morning. Yes, this is the very famous oxygen cylinder. Can you tell me what is the pin code for oxygen? Nitrous oxide का color, cyclopropane, Entanox. Can you tell me the colors? Yes, the pin index is 25. So these are the tables which you need to remember. ये आपका कौन सा cylinder है? Oxygen का. Then you have nitrous oxide, which is blue, completely blue in color. अगर blue, what do you say? Blue body and white shoulder, that is Entanox. And then air is white shoulder gray body, right? Carbon dioxide is this one, right? Very good, very good. So these are very important, plus these pin indexes are very important. They've come many times. Yes, Antinox is 7. Okay, Antinox is 7. Very good. तो ये बहुत important है. What about this one? Again, one of the very most common question. और इसमें क्या पूछते हैं? Either this or the most commonly used cannula, right? For supplementation of fluids, dehydration में. फार्मा भी थोड़ा रिवाइज कर लेंगे. तो yes, so this is what is the patient having? A patient has a gunshot injury with hypotension, and what happened to the patient? Since he has gunshot, he will be having active bleeding. तो क्या करना है bleeding में? You will give fluids as vigorously as possible. देखो मेरी tongue भी it's not working. Yeah. Okay. हाँ. So you will use the wide bore cannula, right? You will use a cannula which has the widest bore, right? So yes, that is orange. So which is the most common cannula? Can you tell me which is used for IV fluids in adults? In adults, IV fluids. In adults, IV fluids. Can anybody tell me? Green. It's actually pink. Pink. Okay. For IV fluids, you go. जाओ आप बोलो मैं बीमार हूँ and go to the hospital. They'll put a pink cannula. Okay. And all those people who get sick, जो Instagram पे डालते हैं, so they also have a pink cannula. So yeah, it is most usually we use the pink for IV fluids. For giving blood, yeah, for giving IV fluids very fast. For patients who are losing blood, we use orange and gray because they have the widest pore. And then blue is used for children, right? While your very elderly patients or neonates, preterms, violet is used. तो आपको इसका mnemonic याद है? From lava, sun, this was the mnemonic, right? To go through this, what are the gauges? The widest bore is 14 gauge. Then you have the gray, which is 16. Green, 18. 20 is pink. Blue is 22. Yellow is 24. And finally, 26. Right? Everybody remember this? Yeah, yellow is also used. See, yellow and blue, they are used most commonly. Right? Flow bhi yaad nahi karna. What they do is, they give you an IBQ from this. Right? IBQ देते हैं, and what IBQ do they give you? कि like this. Can you see? Either they'll give you this, or they'll ask you, this pink color cannula is there, what is the gauge? Right? So you'll be able to tell it is 20 gauge. If they ask you what is the gauge of the violet cannula, तो क्या बोलोगे? 26 gauge. Right? Everybody with me? Give me a yes. समझे? This is the kind of question that comes from this topic. So if they ask you for most commonly in adults, which cannula will you use? So for IV fluids, we will be using pink. Okay? For IV fluids in adults, we will be using pink. What about if they tell you in elderly with spidery veins, which cannula will you use? So it will be violet. Okay? Got it? Everybody? Yes. Very good. Good. Keep up the josh. Tell me about this now. So again, important question. और बहुत बार आ चुका है, right? Yes, see, in hypotension, see, even in dehydration, in moderate cases, we can put the pink cannula. There's no need to go like very fast and you need to do that. Pink cannula ही देते हैं. But in case of bleeding, where you are already losing blood, right? वहाँ पर you have to be very vigorous. You have to make sure that the fluids are getting in the body as fast as possible. इसलिए wide bore, right? Yes. So can you see? This is the sclerotic line of Frankel. Okay. This is known as the line of Frankel. So this is actually seen in, very good, it is seen in scurvy. So vitamin C, again, very, very important for the exam, right? So can you tell me all the things related to vitamin? Yes, Sandeep Palmer, very good, very good. Dengue में you give normal saline. Yes, yes. Sneha, very good. So, scurvy mein, can you tell me what is it due to? It is due to the deficiency of vitamin C. And what good things can you remember about vitamin C? अजीम शेख आप तब से एनएलसी की नशे नशे में गा रहे हो. Can you tell me the good things about vitamin? Yeah. So I'll write them down. It helps in iron absorption. Okay. It helps in iron absorption. It helps in collagen synthesis. Okay. It helps in wound healing. So collagen synthesis, you remember? Wound healing, right? It helps in wound healing. Very, very important. Whenever you want, you have a wound and you want to heal it faster, vitamin C is a very good antioxidant to help you in that. Yes, and the fourth one is, it is an antioxidant. It does collagen synthesis. That's why you see all those female wearing serum, vitamin C serum. हम गोरे हो जाएंगे and all that. Okay, but it works, huh? Even I use vitamin C serum. Okay, it is an antioxidant. So, screen में lag है. Is there a lag in the screen? I'll show you rickets ke pictures. Okay. Plus, if there was another question in relation to, there is a lag. Yeah. So antioxidant, we all know it is ACE and the most potent is E. Okay. Most potent is E. We all remember that, right? Very good. What about your, and then you have scurvy, which can give you gum bleeding. That is what the deficiency causes, right? Screen lag is there? Okay. So this was about vitamin C. Then iron absorption, I told you, the absorption is done through duodenum. So the resection of duodenum will give you iron deficiency. Another thing was, this causes, vitamin C helps in iron absorption. Which one stop or prevent iron from getting absorbed? Can you tell me? Can you tell me which ones? Because that was another question. So you remember this. It is oxalates, phytates, and tannins. Okay. So these three actually inhibit iron absorption. Right? Yeah, very good. So remember them. Very, very important. Okay, these are all PYQs. Then look at the options. Your osteoporosis, most common in what? Hello, good morning, Vaibhav. PYQ wali didi. Arey. Okay. Osteoporosis most common in postmenopausal women. Okay, postmenopausal women. And what is the drug of choice? Again, bisphosphonates. Like alendronate, right? Thank you. And beriberi, can you tell me what is it caused by? Anybody can give me an answer for that? Beriberi is caused by? It is caused by vitamin B1. So we have two types of beriberi, right? Wet and dry. Yes, very good. What else does vitamin B1 cause? So again, very, very high yield questions. Your vitamins, 3 to 5 questions come every year. So even biochem पूरा नहीं किया पर ये कर लिया तो you know questions will come from it, right? So yes, Wernicke's encephalopathy, and it has the combination of CoA, right? So again, can you tell me this image? Anybody could tell me what can you see on the image? So if you can see your radius and ulna, you can see that it is kind of frayed. This is known as fraying. The bones are widened, which is known as splaying. Okay, splaying, fraying, and they become in a cup shape, right? That is known as cupping. So this is now seen in rickets, right? Very good, very good. And there is bowing of the legs, right. And I told you about rickets and osteomalacia. What do they have an increase in? Yesterday we just did it. Okay, and you can see you have your line of Frankel plus you have this. This is seen in scurvy. Okay, this is seen in scurvy. So please go through the images. Just go through this PDF. And vitamin B1, I told you. Another thing about vitamin B1 is the absorption of vitamin increase decreases with alcohol. So it is very common where they'll give you a clinical case of a alcoholic going under withdrawal or something, which I'll show you a question. Yeah, SAP. Yeah, very good. Halibut oil. Yeah, Sandeep, very good. So one good thing about the comment section, which I really like, is you are also recalling the PYQs. And I really like that we are doing this all together. Or yes. तो तुम लोग मेरे क्वेश्चन ही बोल दो यार. Okay, yeah. So vitamin B1, what does it cause? Very, very wet and dry. In wet, I just want you to remember that cardiomegaly is seen. Okay, wet cardiomegaly is seen, right? And we all know Wernicke's encephalopathy. You have GOA. What is GOA? Global confusion, ophthalmoplegia, and ataxia, right? And how do you do the assessment? With this question was also asked, PYQ again. Okay, so how do you assess vitamin B1? It is done by RBC transketolase. What about vitamin B2? Anybody can tell me about vitamin B2? How do you assess vitamin B2? And what does vitamin B2 cause? So yes, you are thanking me. Glutathione reductase. Very good, very good. Okay, riboflavin, and you have angular chelosis. Okay, angular chelosis. Right? Very good, very good. So vitamin B1, you have Wernicke's encephalopathy. You have very, very wet and dry. Wet may, I told you, what do you remember? Cardiomegaly. Okay, and peripheral neuropathy is seen and dry. Then vitamin B2, what do we have? We have angular chelosis. Okay, it is very much associated with angular chelosis. Plus, yeah. So this is your fish mouth vertebrae. Fish mouth vertebrae. Another fish mouth we saw yesterday. Can you tell me which fish mouth we saw yesterday? Can you tell me? Fish mouth, we saw the mitral valve, right? Stenosis in RHD. There was a fish mouth or buttonhole appearance, right? Okay. So pot spine is actually seen in TB, Gayatri. Yes? Yeah. So metastasis, you remember the cannonball appearance? So this was an IBQ. I showed you already. Yes, mitral valve, IHD. And then we have Paget's disease. What kind of vertebrae do you have? So I'll show you. Which vertebrae is this? Can anybody tell me? Which one? So all in one. I really like it. कि सब साथ में पढ़ लो ना. Yeah, metastasis from Koru. Cotton wool, Paget's disease for skull. Very good, very good. So yes, this is your bamboo spine seen in ankylosing spondylitis. Revise with me ankylosing spondylitis. I told you 4 questions, right? I told you 4 questions. Bamboo spine. And then this is, you can see the fish mouth vertebrae. Okay. So codfish or fish mouth vertebrae. Again seen in osteoporosis. And then this one, can you see the vertebrae, the sclerotic line surrounding the perimeter of the vertebrae? This is seen in Paget's disease. What is this? Picture frame. Okay? Picture frame. Right? Yes. HLA-B27, the most common joint involvement is sacroiliac joint. Then it has the association, strong association with anterior uveitis. And finally, what did I tell you? HLA-B27, this. Right, and bamboo spine and dagger spine also, right? What will we see in osteoporosis? You will see this. This was a question in osteoporosis, right? So the answer for this is osteoporosis. A 70-year-old female, remember, they will always give you a female that is postmenopausal. Postmenopausal, okay? And what do you do here? You will give what will be the treatment? It will be bisphosphonates like alendronate, right? Yeah, very good, very good. What about this one? So again, we have these images. So can you tell me this? Yes. There is back pain. Ankylosing spondylitis, young male, remember that. Okay? So this is your single bubble sign. Very good, single bubble. And it is seen in single bubble. Okay, it is seen in Bubble. Do you remember Bubbles from Powerpuff Girls? She was my favorite character, but I always associated myself. See, chashma nikal gaya. I always associated myself with what do you call it? Bubbles. Then there was Buttercup. I forgot the names. Yeah, yeah. So this is yes. Which one? Hypertrophic pyloric stenosis, right? Hypertrophic pyloric stenosis. Okay, yeah, and this, can you tell me how will be the vomiting? Bilious or non-bilious? Mojo jojo, yeah, blossoms, bubbles, and buttercup. Yeah. Okay, non-bilious vomiting, very good. Non-bilious vomiting. Can you tell me what will be the electrolyte imbalance in this patient? Non-bilious, and what do you feel on the stomach? What is the other image that comes in this question? What is the other image? Hypokalemic, hypochloremic. Very good. Yeah, there is pyloric stenosis. That's why there is no bilious in the vomit, right? Yeah, olive-shaped lump. Shaped mass. Okay? Right? This is very, very important. And there is metabolic alkalosis. Very good, very good. So what about this one? This is your, can you see? This is your, which sign? Which sign is this? Yes, this is your double bubble sign. It is seen in duodenal atresia and also seen in duodenal atresia as well as annular pancreas, right? What about this one? What about this one? Which sign is this? Which sign is this? Can anybody tell me? So this is your multiple bubble sign. You can appreciate there are multiple bubbles, right? No, this is not triple bubble. This is multiple bubble. That's why I know you will say triple bubble next. So ma'am bahut harami hai. Okay? Multiple bubble sign. So this is seen in ileal atresia. Okay? This is your, can you see 3 bubbles in this? Here it was multiple. This is the triple bubble sign, which is seen in jejunal atresia. Okay? Got it? ठीक है. तो jejunal atresia is triple bubble sign, multiple bubble sign is ileal atresia, double is duodenal atresia as well as annular pancreas, and then your infantile hypertrophic pyloric stenosis, that is single bubble. Okay? अरे भाई क्यों marked है क्या सब कुछ? No, only one question was marked. So now look at this. What is this? Again, very simple question asked many times. सब बताएंगे, जल्दी बताएंगे, क्योंकि ये simple है, right? Can you see if all the bars are hugging each other? Okay, and there is a continuous frequency, right? It is continuous. So continuous is your histogram. Bar diagram. So bar diagram has spaces in between. Now bar is and frequency polygon. I'll just show you the images. This is your frequency polygon, right? And on the line, you have your frequency. This is your frequency polygon. Then you have, what is this? Can you tell me what is this that I drew? This is your line chart, right? What about if the data goes only up? It doesn't go down at all. If the data goes only up. Ogive, very good. Okay, it is ogive. If the data goes only up, like the data doesn't come down, then that is ogive. If it is coming down, then that is line diagram. Okay? Yeah, very good. Line diagram shows you seasonal trends. Seasonal trend. Okay? And one of the biggest example of line diagrams is that showing you seasonal trend is COVID. कोविड में याद है आप केसेस चेक करते थे, अरे अरे इतने बढ़ गए, इतने कम हो गए, इतने मर गए, तो दैट इज फॉर सीजनल ट्रेंड्स. ओके, एंड अगेन दिस इज द PYQ. This is your scatter plot and this is your bar diagram. And bar is divided into component and multiple. How does component look? Good morning, Sunil. Component is when it is like this, right? There is spaces and it is like this. And multiple is couple. दो couple साथ में कुछ कुछ कर रहे हैं and there is space. ठीक है? So this is multiple. Got it? Yeah. So I always remember this because of the park. Okay, park में दो लोग बैठे हुए हैं. Now look at this question. Can you tell me the answer of this question? Good morning, Kartike. Good morning, good morning. Yes, good morning. तो I'm sorry थोड़ा जोश कम है पर okay? Yeah. So can you see? This is firstly, whenever you see the image, look and understand. These are round, right? So you can see these are nothing but cocci. Now cocci, it is gram negative or positive. It is purple. So this is gram positive. So we have cocci in chains, cocci in pairs, cocci in clusters. Cocci in clusters, grape-like clusters is nothing but Staph aureus, right? So if you're able to identify that, yes, that itself is good enough, right? Very good. So here cocci in clusters, grape-like clusters is your Staph aureus, and remember Staph aureus is catalase positive, right? So how do you differentiate? What about catalase test? Do you remember your catalase test? How does it look? Even the image of catalase test is very important, right? I'll show you. Look at this question first, फिर I'll do that. Yeah, this is your mannitol salt agar, and it is actually a selective, the most selective media for Staph aureus. Why? Because it kind of, it ferments the mannitol and becomes from pink to yellow, right? Yeah, golden color colonies. Very good, very good. Now look at this question. I'll show you the difference between catalase, coagulase. Tell me about this. A 11-year-old boy presents with acute onset of sore throat, fever, and so wherever sore throat is there, right away, without even looking at question, if they ask you the causative organism, you know that this is going to be related to Streptococcus pyogenes. Very good, very good. The other thing is, if you know this test, if you look at this image, this test shows you a zone of hemolysis, right? You can see that the bacteria here is dead. Why? Because this bacteria is taking like we are putting a drug in this plate, which is known as bacitracin, okay? And which bacteria is sensitive to bacitracin, meaning that there is a zone of hemolysis because of that. That is Streptococcus pyogenes, right? The other thing is sore throat. One of the most common causes of sore throat is your Streptococcus pyogenes, right? Look at the next question. First, also you should remember the Lancet group of classification. ठीक है? सुनो ना, मेरे लिए कॉफी कर दो ना, मेरी आवाज बैठ जा रही है. Yes, very good, Sandeep. So you can see what is the classification. How do you coffee? Black, of course, black. Yeah. So just give me 1 minute. Just give me 1 minute. So you know the classification of your Streptococcus. It is Lansfield classification and divided based on group A. Okay. Look at this question and answer this question for me till I get coffee. मेरी आवाज बैठ जा रही है. बोला कॉफी के लिए. Hmm. Yes, so can you see, look at the test. You can see what do? We take the organism and we put it in which? Yes, so H2O2. Very good. People who answered like A or B. Look at the question. This is what I want you to practice. Practice reading the question very well. Gram-positive cocci isolated from the sputum of a patient. For further identification, the test that is shown is carried out. For which of the following is the test negative? So first identify the test. We put H2O2. It releases oxygens in the form of bubbles, right? So this test is negative for, and this test is nothing but the catalase test where you use hydrogen, and it is negative for, yes, it is B, streptococcus. ठीक है, तो question easy है, but what is the thing? You need to read it properly. I told you yesterday also, the questions that you are good at, make sure you don't get over excited. Read the question properly, क्योंकि बहुत बार ऐसा होता है, we make silly mistakes in the questions that we know. And how do we avoid that? थोड़ा दिमाग से सोचो or take time and then answer. All right? So how do you differentiate? Catalase is actually a test used to differentiate between staph and streptococcus. Right? So staph is positive for it, streptococcus is negative for it. Then catalase, when staph is positive for catalase test, we use another test to differentiate between pathogenic staph and non-pathogenic staph. Which one is your pathogenic staph? Anybody, can you tell me? That is Staph aureus, right? That is Staph aureus. Or non-pathogenic staph is Staph epidermidis, dermidis, and saprophyticus. ठीक है? You understood, right? So now this test that we use to differentiate between pathogenic and non-pathogenic staph is the coagulase test. Coagulase test. ठीक है? So if they ask you which test is used for differentiating Staph aureus with strep, that is catalase. If they ask you to identify Staph aureus specifically, then that is coagulase. So also remember, Staph aureus is positive for both catalase as well as coagulase test, right? तो ये थोड़ी चीजें हैं that you should know, because they'll give you questions based on that, right? Yeah. Plus, you remember your valve. Look at this now. You remember your endocarditis? ठीक है? Right-sided, left-sided, IV drug abusers. You remember those? Yeah. Now look at this question. अरे यार कॉफी बोल दो यार, मेरी आवाज बैठ गई है पूरी. हाँ. So a patient presented with unknown fungal infection on HE. There were a presence of sclerotic body. So this was asked in June. So sclerotic bodies, you have three names for them. They are also known as medullary bodies. They are also known as copper penny bodies. And this is fungal infection. And you know your fungal infections are divided into systemic infections. Can you give me an example of systemic infection? That is candidiasis. Then you have mucosal infections, right? Submucosal infections, which is chromoblastomycosis, porotrichosis, right? This is chromoblastomycosis. Nay, good morning, Logan. And you remember, this is the appearance of copper penny bodies. Okay, copper penny bodies. Copper penny bodies. Good morning, everybody. Yeah, copper penny bodies. Staph is novobiosin resistant. Novobiosin is used for what? To differentiate between saprophyticus and jaldi. Saprophyticus and epidermidis. Which one is sensitive? Novobiosin sensitive, right? and they have verrucaceous lesions, very rough lesions, okay? Very rough lesions, right? So on KOH mount, you can see sclerotic bodies, also known as copper penny, okay? Yes, staph epidermidis is sensitive. And the another brown colored fungi with septate hyphae, you will be able to recognize. So same question, but the language is different. That's why I told you, the same direct question will never come. But will you be able to make the language? यहाँ पर language देख लो. Look at the language. And here, look at the language. Good morning, Nihar. Good morning. So you're able to make out the language? Right. With respect to aspergillus, can you tell me what questions come? This is again, क्या है ये? यार मेरा, I have a very big coffee addiction, ठीक है? And I have a very good this thing for coffee. Like I love coffee. और राव PY ये आ गया PDF. क्या PDF मिलेगा ना? तो मुझसे ना नहीं होता. Like I am very addicted to coffee. तो without coffee, like थोड़ा कॉफी पीने तो देखो कैसा नशा चढ़ेगा मुझे. Okay? Okay, yes, acute angle hyphae, very good. Aspergillosis, acute angle hyphae. The other thing is aspergillosis causes what? Groundnut. If they give you a case of groundnut, okay, groundnut, और फिर वो बोलेंगे कि क्या groundnut, there was a farmer, he had stored groundnut, so that is causing aflatoxicosis. Which cancer is associated with aflatoxicosis? Which cancer is associated? Yes, very good. हाँ, HCC. And HCC में क्या increase होता है? AFP. Right? हाँ. Now look at this question. हाँ, HCC. Yes. Thank you. मैंने बोला था 15 मिनट बाद देना, कॉफी नहीं दिया मुझे किसी ने. तुम लोग अपनी दुनिया में रहते हो. So this is, yes. So we are talking about condyloma acuminata. How does it look? Do you remember the image? ठीक है? Do you remember the image? Yes. It is caused by which form? Yeah, it is caused by HPV. And which form of HPV? 611. So 611 is known to cause warts. Okay? And 18 and 16 causes, तुम लोग सब सुन रहे हो क्या? Yes, very good, Sandeep Palmer. Mustard seeds, the epidemic dropsy. Okay, 16 cervical cancer. Right? Now, can you tell me what is the screening test that we do for, again, very important topic, right? What is the screening test that we do? Good morning. Let me drink my coffee. Coffee पी लूँगी और इतनी गरम करके ला देते हैं ना. And I have this, yes, pap smear, right? Pap smear. And what do we use in pap smear? Do you remember what do we use? We use the Ayer spatula, right? Ayer spatula. And with zone does it, how is it used? So you remember all the instruments? Firstly, what do you use? You use the speculum. What speculum will you use? Cuscos. Co-speculum, ठीक है? Right? And then you open. तो ऐसे करते हैं, खोलते हैं, दुनिया देखते हैं, right? तो you open it and then you use the cytobrush for endocervix and your Ayer spatula for transformational zone, right? Yeah, okay. So this is your HPV. And I told you, what are the vaccines against HPV? Cervarix is a bivalent vaccine. Remember, it is against 16 and 18. What about Gardasil? 16, 18, 6, 9. And Gardasil 9 is for all the others. Okay. So Cervarix, you remember 16, 18. It is a bivalent vaccine. And one question was asked about this. like they gave an accept question and they told that Gardasil is a bivalent. So now you know Cervarix is bivalent while Gardasil is tetravalent, right? And these are actually causes of your HPV. So this was asked recently. Three-man syndrome is caused by what? Again, it is caused by HPV. Some images, again, warts, they are. Yes, 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 Bijaj, very good. Okay, now this one, again, look at the question and answer, easy, na? इतनी गरम करके लाएंगे तो कैसे पिएगा बंदा? थोड़ा देखो, I'm very low maintenance. I have this habit that I get up, I drink coffee, then I don't eat anything till I'm taking class. उसके बाद if I eat, I'll eat somewhere at 5 or 6 p.m. Okay, that's the first time that I eat. तो इतना तो like I'm not asking for anything else, like banana दे दो, lunch दे दो, breakfast दे दो, coffee. And how do you make my coffee? Just put coffee, water, हो गया. No sugar, nothing, no milk. Yes, so very good. It is caused by HPV 18. Everybody got the answer? HPV 18. Arey, yes, Ramanath. Yesterday also I gave. So you remember this one? So you remember your DNA viruses? Can you tell me which are your DNA viruses? And question DNA पे हमेशा आता है. Tell me your DNA viruses. It is. What are your DNA viruses? Everybody? Happy. Yes, very good. Happy. ठीक है? तो parvovirus is there. Then, yeah, happy में क्या है? बस happy हो. Herpes. Yes, this is actually herpes labialis, also known as cold sore. Which one is it? HSV 1 or 2? HSV 1 or 2? Herpes, adeno, yes. Parvo, उसके बाद cold sore, right? This is, तो oral में मुंह 1 and then genital is 2, right? So HSV 1, it becomes latent. Remember this, very important. It becomes latent in trigeminal ganglion. तो face पे है ना trigeminal nerve, and then sacral for HSV 2. Again, see, they are ulcers. They are ulcers. तो इसमें mistake नहीं करना. If they show you ulcers and then you हाँ ऊपर एक नीचे दो. Okay, so 1 and 2 you remember with 1 and 2 with respect to 1 and 2. Where else do you see 1 and 2? 1 and 2 का कुछ याद आ रहा है? Like, yeah, you give ganciclovir. 1 and 2 में you remember SGLT. They are what? मतलब I'm going to physio, but SGLT is a, what is this? Facilitated या active transport. Active में कौन सा? Secondary transport, right? It is secondary transport, right? And SGLT 1 we have and 2 we have, right? So 1 is in intestine. तो एक intestine है and 2 is in kidney, right? So this is my kidney. Looks like a butterfly, but yeah, SGLT 1 and 2. हाँ. Okay? So 2 is in kidney while 1 is in intestine, right? तो ये important है. I gave a question in, I'll tell you one question. I put it up in Instagram yesterday. And I told you ना, Instagram Dr. SARA 2731. मैंने सारा ही हटा दिया. ठीक है. तो I posted a question yesterday. Did you see the question? It was about glucose transport. So it was asked that maximally glucose is absorbed in which one? Through what? So I'll tell you the options. Okay. And you know, somebody created my fake ID. कल ही मैंने देखा कि किसी ने मेरा fake ID बनाया है. Yeah. And so, a child with loose stools for 1 day presented to your OPD. On examination, signs of dehydration were seen. The child was given ORS. It facilitates glucose absorption through which of the following receptors? SGLT1, SGLT2, GLUT4, GLUT2. So, see, that is the problem. Everybody, maximum people actually marked SGLT1. So SGLT1 was yes, very good. Yes, yes, it is. Yeah. Did you see? हाँ. ब्लू टिक लगा लीजिए क्यों? हाँ. तो yes, it is SGLT1. Okay, SGLT1. Glucose through intestine, right? SGLT1. Why SGLT1? Why SGLT1? Somebody asked me, why not SGLT2? Because glucose absorption, where does the absorption take place of anything in your body? Where does the absorption of anything take place in your body? Through intestine. And what reabsorption takes place? Through kidney, right? So kidney wala mat bolna, it is SGLT1, right? Reabsorption is through PTSD. Absorption of glucose takes place through your intestine. So SGLT1. Okay. Now HSV3, HSV1 we know it is oral, HSV2 is genital, while HSV3 is your varicella zoster. You know, we discussed this yesterday. This is centripetal and pleomorphic inhalational. And what is the appearance? You can see these are vesicles. They have the appearance of dewdrops on rose petals, right? Now look at this question. Important question. See, many people get, even there will be questions where you'll feel, अरे ये answer है. फिर after understanding the theory, you will be like, I knew this. So there you think a little bit more. Okay? मुझे coffee पी लेने दो. Okay, in an accident, there were 74 dead, 4 were severely injured, 20 moderately. Color coding in the triage from highest to lowest. So highest will be given to high to low जाना है ना? तो क्या होगा? Black से highest priority will be given to what? Red. Yes, yes. Highest priority is red. Then you have yellow. Then you have green. Then black. Right? Green is what? Ambulatory patient. What do you mean by ambulatory? They are almost fine. What about black? Black are dead. Okay? This, yes, very good. Urgent, very urgent. This, urgent but can wait. Okay? So again, I'm telling you, these are the kind of questions which come again and again. Okay? And simple. But what was your first, many people who said the answer is B. What was your first reaction? Like, jaldi mark karna hai. So be careful. This is your triage. Okay? This is your triage. You can see red is life-threatening and you have to. That will be the first one to save. Immediate. Yellow you can delay because they can wait. Okay? They can wait a bit. They are also serious, but they can wait. Green is very minor. While black is moribund or dead. Okay? Or in coma, they are not expected to survive. So the people that you cannot save, just leave them. You can't save them. ठीक है, उनके पीछे it will just get toxic. All right? Yes, very good, Amar. Very good. So this is also a very important topic. हाँ, language. See, one good thing I'll tell you. We don't have 19 subjects. We actually have 20 subjects. The 20th is English. I always tell you this. If your English is good or you're good with reading the question, you will be able to, you don't have to study everything. English अच्छी होनी चाहिए, question अच्छे से पढ़ना चाहिए, you will be able to solve it. Right? I always tell there are 20 subjects, not 19. Now look at this splint. Look at this splint. Tell me the answer for this. अब मजा आ रहा है. अब मजा आ रहा है. PSM कराया था मैंने. PSM I already did. मजा आ गया. चाय पी लो. हेलो दोस्तों, चाय पी लो. There was a meme, right? Okay, very good. This is your tailor brace. What about this one? What about this one? Now this one is for the shoulder. ये कौन सी है? Which one is this? Scoliosis, Milwaukee. Very good, very good. What is this? ये खुला हुआ कौन सा है? Scoliosis, Milwaukee. This is your von Rosen splint, right? Yes, CDH. Very good, very good. Which one is this? This is your tailor brace. Von Rosen splint, okay? Yes, DDH के लिए. And look at this question now. So, von Rosen splint, your Milwaukee and tailor brace. Anyway, Paras तो कराया है ना image based chanting. Look at this question. A 64-year-old woman Anisha, if they are telling that one of the following is not the differential diagnosis, means 3. If I talk about HPV, okay, so virus है. HPV से कौन सा? I told you, Treeman syndrome होता है. We have warts. Then we have. So there are 3 differential diagnoses. Out of that, which one will never be like that? So I'll give you cold sore. Cold sore is done by HZV. So that is not a differential diagnosis, right? Question वैसा रहेगा. Got it? Yeah. So reduced joint, bilateral, just remember this one line. Bilateral reduced joint space, that is directly, close your eyes and mark osteoarthritis, okay? Joint space, bilateral reduced joint space. So that is osteoarthritis. What about ankylosing spondylitis? This patient will be, I told you, right? It will be a young male. Always remember, young male, and he started having back pain, okay? What about your rheumatoid arthritis? Rheumatoid arthritis is most commonly seen in a female, okay? And they will be having morning stiffness, plus, you remember the swan neck appearance? What happens to the swan neck? How is the PIP and DIP? Can anybody tell me? Can anybody tell me? Yes, earliest, you remember? Yeah, and MCP is paired, and MCP is paired. Osteoarthritis. What about your DIP में? Distal in, yeah, इसमें it is flexion, while PIP. DIP में flexion, while PIP में, I mean PIP में flexion, DIP में flexion, and PIP में hyperextension, right? Okay, Botaniers, and there is Botaniers swan neck deformity. Yes, DIP में flexion and PIP में hyperextension. You remember the swan neck? I'll show you an image थोड़ी देर में, ठीक है? Yes, and mallet finger. Mallet finger, you have only flexion, right? हाँ, pipe. Okay, very good. Hemophilia is related to which one? Can anybody tell me what happens in hemophilia? Very good, very good. Sania, very good. Tell about this now. A 13-year-old girl presents to ED, falls on outstretched hand. Hemophilia is factor 8 deficiency. Okay? Remember factor 8. 8. And also presents with what? Arthropathy, right? Very good, very good. Knee swelling, that's the thing. Arthropathy presents with. Very good. So you can see there is fracture of ulna with your dislocation of the radial head. This is Galeazzi fracture. What about Montagia? Sorry, this is actually mat bolna, I already know, I know. Montagia fracture, Galeazzi is where there is a fracture of the radius. I marked the right thing now. And this is your dinner fork deformity, right? Yeah. Okay. This is your dinner fork deformity. So you can see which one is radius, which one is ulna. You can see which one is broken. It is the ulna, and this is the radius, right? You can see the head of the radius. So this is dislocated from this side. So this is ulnar fracture with radial head dislocation, while this one is your radius. You can see radius which articulates with a, which bone does it articulate with? Very good. Very good. I was actually looking for this. Your scaphoid is the most common fractured carpal bone. Very good, very good. Carpal bone. Right? You remember this? Yeah. And this is your Galeazzi fracture. While this one, you can see, is your dinner fork deformity, Colles fracture. Right? Yeah. Very good. Very good. Avascular necrosis, it causes lunate is most commonly very good. What about this one? Again, very, very simple question और बहुत बार आ चुका है, बहुत बार. अरे very good Sandeep. Anterior dislocation of hip, Fadir. Posterior is Fadir and Fabir is anterior. Yeah. Which one presents with posterior dislocation? Very good. Yes, you can see the soapy bubble appearance. Okay, soapy bubble appearance. So this is giant cell tumor, also known as osteoclastoma. Okay, osteoclastoma. Right? Very important question. Very important question. बहुत बार आ चुका है. So tumor, and it is the tumor of the distal end of radius. Right? What about this one with splint is this? अब मुझे थोड़ा like जान वापस आ रही है मेरी. It is used for what? What is it used for? Dennis Brown splint. It is used for CTEV. Okay. Very good. Very good. CTEV, clubfoot. Very good. Very good. What about this one? Very famous question जो हर बार आ चुका है. So this is an except question, right? Except means you have to rule out. तुम तो सोच रहे हो ना कि कॉफी में कुछ मिक्स्ड है. अब मेरी सुबह शुरू हुई. अब चलो. चलो. Yeah, it is most commonly seen in African children, right? African children. एक यहाँ पर yeah. And your Burkitt's lymphoma, it is also associated with a cancer. Can you tell me which cancer is it associated with? Yes, very good. So c-MYC gene mutation, yes. And which translocation? Translocation 814, right? 814. It is associated with EBV, very good. EBV is also associated with, can anybody tell me what other cancers? क्योंकि EBV पे ये क्वेश्चन आता है. Which other cancers? Yeah, jaw claudication. Okay, translocation 814. This is non-Hodgkin's lymphoma. Yes, Burkitt lymphoma. Of course, starry. This is your starry sky appearance. Starry sky appearance, right? And it is more commonly, no, it is seen in children. So, yes, it is associated with NPC. It is associated with NPC. It is associated with Burkitt's lymphoma. It is also associated with Hodgkin's lymphoma. ठीक है? And nasopharyngeal carcinoma. We all know 50% of the cases have association with EBV. Okay? Monoclonal infectiosis, yeah, it causes mononucleosis, monoinfectiosis. Okay, monoclonal infectiosis. What is that? That is also known as the kissing disease. Chuma chati, right? So it is most common in adolescents. All right? All right, very good, very good. Now look at this question. Look at this question now. Patient with a history of chronic alcoholism presents with a microcytic anemia and thrombocytopenia. On blood smear, numerous oval macrocytes are given. Hypersegmented neutrophils are also seen. So can you tell me what is the normal lobes of a neutrophil? How much lobes are there in a normal neutrophil? What do you mean by a hypersegmented neutrophil? So neutrophil is there. It actually has around 3 to 5 lobes. So if it has more than 5 lobes, that is a hypersegmented neutrophil, right? And hypersegmented neutrophils as well as macroovalocytes are a big finding of what? Megaloblastic anemia. Okay? And megaloblastic anemia is caused by 2 vitamins. Which one? B9 and B12. Okay? B9 and B12. So, isme, what is the answer? Yes, you are right. It is folic acid deficiency. So, just because there was a history of chronic alcoholism, don't mark anemia of chronic disease, right? So, how do you differentiate between vitamin B6, vitamin B9 and B12? How do you know this is not, we don't have the option of B12 here. What if I remove G6PD and I put B12 here? So always remember this question will 100% come. Vitamin B12 बहुत बार आता है, हर session में आता है. And yeah, so how do you differentiate? Both of them cause homocystinuria. I told you yesterday B6, B9, B12 all cause homocystinuria. Which one? Where are methylmalonin levels increased? So yes, methylmalonin levels are increased in B12. Okay? While they remain normal in your B9. Okay? They are normal in B9. Then what else? Neurological symptoms. Very good. Vitamin B12 shows you, I've written it down. Methylmalonin, you can see, this is the image of hypersegmented neutrophil. Alright? And methylmalonin, I told you, it converts to succinyl-CoA. Succinyl-CoA used for making myelin sheath. So myelin sheath, agar directly nahi bani, so you can have subacute degeneration of cord. Subacute degeneration of cord. Okay? So 3 questions that came from vitamin B12. One is, which is the deficient vitamin in vegans? Yeah, strict vegetarian. Okay, so vegan, strict vegetarian. The other was about terminal ileum. I already told you. Okay, if terminal ileum is resected, which vitamin will be? कहाँ गया यार? Acha, I can take a break today. Okay, I can take a break today in terminal ileum resected. which vitamin will be deficient? So yes, it will be vitamin B12. Or duodenum mein, of course, it is, duodenum is iron, ileum is, and terminal ileum, the most common position for what? For what? For which disease? Tell me. Terminal ileum. 2 diseases. Tell me. Chalo. Always there should be an integration of other subjects. The other thing was hypersegmented neutrophil. Remember this? ये question बहुत बार आ चुके हैं. See, you can see the lobes. 1, 2, 3, 4, 5, 6, 7, 8, 9. It's so hypersegmented, right? TB and Crohn's. Very good, Prince Davis. TB and Crohn's. Okay? Yeah, ileocecal TB and Crohn's. So, ileocecal TB shows you what? It shows you. What does it show you? Yesterday we saw. Both of them show you string of Cantor, right? Okay, this is the thing. So let's go to the next, G6PD. Now let's discuss the option. Anemia of chronic disease, remember, it is microcytic, but the most common presentation is normochromic normocytic. Okay, so if they give you a case of anemia of chronic disease, they will tell you about a patient. Like my dad has rheumatoid arthritis, so they'll give you a 56-year-old male presents with rheumatoid, which is actually uncommon. Because you know, we are all special people. My dad, rheumatoid arthritis is actually supposed to be in females, but my dad has it. Okay, so normochromic normocytic is the most common presentation. Yes, very good. And iron deficiency anemia, you know, it is hypochromic. Microcytic, you see pencil cells here, plus you see anisocytosis. Anisocytosis, you remember? The measurement of anisocytosis is done by RDW. This is also asked, and PYQ, so that is variation in size, while poikilocytosis is variation in shape, right? So all these is seen in your, yeah. Everybody's with me? You're able to understand? Can you give me a yes? Look at this. Again, very simple, very easy question, but बहुत बार आ चुका है. Yeah, what about G6PD? We didn't discuss G6PD, right? What do you see in G6PD? So remember, G6PD is, yeah, very good. G6PD is an enzyme defect, right? Okay, because of enzyme defect. And what do you see? What cells do you see? You see Bite cells and Heinz bodies. Heinz bodies are due to the hemoglobin precipitating out. So this is the image, right? Ye out hota hai hemoglobin. It's a blue dot outside, and then it is eaten by a macrophage, making it a Bite cell, right? Yeah, very good. So this is actually an image of your kidney, and it is showing you infarction. You can see the tissue architecture is maintained. Okay, tissue architecture is maintained. So this is caused by coagulative necrosis, which is the most common necrosis seen in solid organs. Okay, so you have, when we talk about general patho, what does it start with? Thoda revise kar le patho. थोड़ा रिवाइज कर ले. Multiple myeloma, Russell and Dutcher bodies, Rachna. And you remember general patho में, general patho, did we do patho last time? Did you watch patho? Okay, so we can do it after the break. I'll just put some patho questions, patho and pharma together. ठीक है? So anyways, what you have to remember is, what happens to the cell? There will be injury. Injury will lead to what? Injury will lead to cellular adaptations. What cellular adaptations do you have? Remember, revise with me. Cellular adaptations, you have hyperplasia, hypertrophy, okay? What else? Metaplasia, atrophy. Okay, so what is hyperplasia? It is an increase in number of cells. This is increase in number of size. Hypertrophy, one example is your HOCM. You remember HOCM? Your hypertrophy cardiomyopathy, right? And what about तो मैं बहुत इधर उधर हो जा रही हूँ. And atrophy, one question that had come in atrophy is that it is the decrease in number of cells as well as the size of cells. Okay, remember this. All right. While your, what about your metaplasia? Can you give me an example of metaplasia? One of the most common metaplasia which comes in a question again and again. What is that? That is Suttabaz. I'm kissing my lips. No, no. Okay, Suttabaz. No, Barrett's. No, not Barrett's. Barrett's का किसका सुना है तुमने? It is Suttabaz. Suttabaz is what? Which epithelium do you have? अरे group B streptococcus. Breathe. Smoking में क्या होता है? Smoking में there is a change of epithelium. What is the epithelium? It is ciliated columnar epithelium. Columnar, and it changes to ciliacum because to propel foreign body out, right? And it changes to squamous. This is the most common, not Barrett's esophagus. Okay, not Barrett's esophagus. And the other question, Barrett's esophagus, you remember? Barrett's esophagus का क्या scene है? Barrett's में you have the change of, what does it change to? Squamous, which is the pinkish, changes to columnar. And now this columnar actually is intestinal metaplasia. Okay, so if they give you two options, intestinal, देखो मेरी spellings में क्या हो जाता है, intestinal metaplasia. तो if they give you an option from intestinal, तो intestinal में क्या करोगे आप? Which one will you choose? Columnar या intestinal metaplasia in Barrett's esophagus? Yes, Vikram. Very good. You will choose intestinal because goblet cells are there. Goblet cells are stained by. Goblet cells have mucin. Mucin is stained by Alcian blue. All of these are PYQs. Okay, all of these are PYQs. Another example for your metaplasia is myositis ossificans, right? You remember? These are your adaptations, cellular adaptations. Then if your मतलब आप इतने मतलब हरामी हो कि अपनी बॉडी को बोलते हो कि नहीं भाई मैं स्मोक करता जाऊंगा तो what will happen? Now your body has done as much as it can and now you will have irreversible injury. Okay, irreversible injury will lead to what? Cancer, metastasis. All right, so that, okay, very good. Okay, I am going to the next question. Look at this question. I am talking a little fast, sorry. Good morning, Bharat. Fatigue, pallor, abdominal pain, patient memory loss, physical examination. What can you see? Basophilic stippling. You can see. What can you see? ठीक है? So this is which poisoning? Yes, this is lead poisoning. Very good. And you can see the wrist drop. Very good. Wrist drop. Which nerve is involved with wrist drop? Yes, Botanian lines you can see. So you have Botanian, ABCD of, radial nerve. Very good. So this is your, isko khada, I have those jokes now, simple jokes. Yeah. So iron poisoning mein, which is the drug of choice? The drugs matter a lot here. Okay? What drugs you will give for what? So iron we have desferoxamine. Okay? So this is the other question. This is iron poisoning, right? Yes, desferoxamine. Very good. So look at, isse ek question aayega. And last time also I told, this time also I'm telling, ergot derivatives, we give nitroprusside. Okay? Ergot, like derivatives are used in migraine, were used in migraine, not used anymore. Why? Because they cause necrosis, right? Yeah. And then beta blockers, they are given glucagon. Glucagon comes from which cells of your pancreas? Which cells of your pancreas? And then carbamate, of course, organophosphate poisoning, carbamate poisoning, we will give atropine as the drug of choice. It is also the drug of choice for bradycardia, right? Bradycardia, right? Yeah, alpha. Acha, with respect to your cells of pancreas, you remember alpha makes glucagon, beta makes kya? Your insulin, right? So there was a question in NEET where they asked beta cells, or this is made by beta cell. Which of the following is made by beta cell? But they haven't given insulin in the option. Okay, so the options were somatostatin, glucagon, amylin, none of the above. So now what will you choose? What will you choose now? So amylin, okay? Beta cells, insulin as well as amylin, all right? So physio का एक question है. And flumazenil, you all know, it is for benzodiazepine, okay? So go through this carbon monoxide, and can you tell me carbon CO poisoning में what kind of this thing happens? You remember that physio question जो आता है, CO poisoning में what kind of anemic hypoxia? Very good. Anemic hypoxia. Okay? Hypoxia. And cherry red. Very good. FMTV solve हो गया. Also, lithium is done through hemodialysis. एक एक्सेप्ट क्वेश्चन आता है इससे. हीमोडायलिसिस कौन से? ओके? आज के सेक्शन में कितने क्वेश्चंस होंगे मैडम? अभी तक तो बहुत क्वेश्चंस ट्राई कर रहे हैं. लेट्स सी व्हाटएवर कैन हैपन, जो खुदा को मंजूर. ओके? Yes, very good. You have your lithium. Anyway, I'll show you the image. Lithium is actually which shaped heart? Box shaped heart. Heart, because it causes Epstein anomaly. So we do not give it in, right? Martin, abhi tum kya karogi? What else can you do except chanting and PYQ? You don't have time. Abhi, there is no point of asking, na? Is it enough to pass? See, like घूम फिरा के we are solving a lot of questions. Okay? Yeah. It is tricuspid atresia. Very good, very good. Veera. Tell about this. Yes. So, can you see a patient's serological status is noted? HBS AG and EG is positive. What is the diagnosis? Yes. HBS AG is positive and EG is positive. EAG is nothing but the marker for infectivity. So, you remember your hepatitis, very, very, very important. What about Councilman bodies? Can you tell me where do you see Councilman bodies? Councilman bodies. Anybody can tell me about Councilman bodies? Where do you see Councilman bodies? Acute viral hepatitis. Very good. Acute viral hepatitis. Okay. Very good. Very good. Very good. So remember this, Councilman bodies are seen in that. With respect to bodies, do you remember all the other bodies that we have? Yes, Mallory bodies in alcohol. Any other bodies do you remember? Try to remember, try to recall. Yeah. Basha, Hirano bodies. Okay, Negri bodies is seen in, Negri is seen in asbestos bodies, asbestosis, very good. Lewy bodies, Parkinson's. Negri bodies in rabies. Okay, this is an like post-mortem finding, right? Then you have Russell body, Dutcher bodies, those are seen in multiple myeloma. Lewy body is seen in Parkinson's. Then you have your Alzheimer's में कौन सी bodies दिखते हैं? Hirano bodies, very good. Hirano in Alzheimer's. Crayola bodies in asthma. Crayola bodies. 3 C's are there in asthma, na? So you have the Cushman spirals, the Charcot-Leyden crystals, and Crayola bodies, right? Very good, very good. So remember, ऐसी revise करते रहना, ठीक है? So look at this question. Answer this question. We are in hepatitis now. Important topic. Asteroid bodies are seen in 2 diseases. Asteroid bodies is seen in sarcoidosis as well as porotrichosis. Okay? Yes, very good. Martin, yeah, very good, Vikram, very good. तो ये सब बच्चे पास हो रहे हैं, सबको पता है. pH का क्वेश्चन तो है. So what is this? Yes, this is your, that is drugs causing Parkinsonism, right? Drugs, yeah, Sandeep Palmer, very good. So this is, yes, whenever hostile comes, remember this is related to diarrhea, right? This is related to diarrhea. So, and what investigation will be the following? The best is IgM for hepatitis A. You can rule out B right away because it is related to blood, right? And here we are talking about diarrhea or feco-oral. Feco-oral are A and E. So you remember your 3 antigens. What are your 3 antigens? Just go through these notes. These are your antigens. कौन से? These are your antigens. HBsAg, which is the surface marker, which is the first one to appear in blood. Which one never appears? That is the core antigen. And the marker for infectivity is hepatitis EAG, right? Hepatitis EAG. Very good. Yeah. Okay. What about your antibodies? So antibodies is actually, yes, these are your antibodies. Okay? These are your antibodies, and go through them. Very, very important. Core antigen will give you IgM and IgG. Okay? Core antigen will give you antibodies, which are IgM and IgG. So this table also, go through this. I would have solved it, but it takes time. Okay? Okay, Ghazi, thank you so much. Look at this next question. Just remember, some ground rules for hepatitis. Ongoing infection, always the surface marker HBsAg will be positive. Okay? Anti-HBs only comes when the person is totally cured or vaccinated. In an acute infection, it's always IgM, and in chronic, there is IgG. Okay? Okay, very good. So this is fat, and fat is stained by 2 things. Which one? Sudan black B and oil red O. Okay? Oil red O. Persian blue is used for iron as well as hemosiderin. Right? PAS and TDT we can use for ALL, and Alcian blue is used for mucin. Right? Very good. Okay. So amyloid, you remember about amyloid? इसका याद रखना, Congo red stain है, and bipharynges, it shows on polarizing light, it shows apple green bipharynges. ये याद है सबको? Right? It shows apple green bipharynges. Just give me 1 second. Yeah, it shows apple green bifringes. Very good, very good. So screen is not, screen stuck हो गई है क्या? Screen stuck हो गई है. And then leprosy, you remember this is the June PYQ. We don't have a culture media for leprosy. It is, see, when you take, consider the examination. अरे यार, एड सर्वर चला गया मेरा. Yeah, screen is gone. Screen is gone. 1 minute, give me a minute. Till then आप मुझे देखो. Okay, look at my face. Look at my beauty. Yeah. Wait 1 minute. Sandeep. Yeah. Okay. Can you see the screen now? Can you see the screen now? Okay. Very good. So, yeah. Culturing is not there. Culturing is not there. Okay. Culturing is not there. So what we can do is we can grow it on footpad of mice or armadillo. Okay. And you remember that there are 5 types of your leprosy. Starts with T, ends with L. Okay. TT, BT, BB, BL, LL. All right. So I just want you to remember the lesions. Go through the PDF, but I want you to remember the PDF. Look at this. This is a lesion that is seen in TT. What is the lesion? What is the lesion in TT? This is an annular lesion. Annular lesion has central clearing, you can see, and raised borders, right? So this is an annular lesion. Remember this. This is seen in tuberculoid form of leprosy. Okay? TT wala annular lesion. Just remember it now. Let's not, distract ourselves. और इसमें lesions कितने होते हैं? 1 to 3. Okay? As you go forward, what happens? And remember, leprosy is involvement with nerve, and it is a chronic granulomatous infection, right? So nerve involvement and chronic granulomatous infection. अभी गया क्या फिर से? अरे गया क्या? चला गया? नहीं यहाँ नहीं गया. Okay. Okay. Right? Yeah. Thank you. Okay. Sorry. So again, remember annular lesion, how many lesions? 1 to 3. And as it progresses, if your immunity is bad, that means आपको होता रहेगा और leprosy होता रहेगा, right? Borderline C. And granulomatous disease, so it causes anesthesia, nerve involvement is there, alopecia of course, because it is destroying, right? This is which lesion? You can see this is the big lesion, and the Mycobacterium leprae is trying to get out, leaving a satellite lesion, right? So this is seen in BT, और ये PYQ है. Annular lesion भी आ चुका है NEET में, and this is a PYQ. Okay, so this is your BT satellite lesion, annular lesion in TT. This is BT. So hello. And then you have this you can see the lesions are everywhere scattered like a map. So this is your geographical map like lesions. Okay, geographical map like lesions. So these are actually seen in BB. Okay, these are seen in BB. So annular lesions in TT, BT में satellite lesion, geographical map like in BB, and BL में you have almost symmetrical lesion. Okay, almost symmetrical. You can see this is a little bit down, so they are very symmetrical, but not completely. So almost symmetrical lesion. Okay, and the last one, LL shows you linine facies, right? It shows you linine facies. So we divide Again, I'm showing you, this is line facies, your almost symmetrical lesion seen in BP, BL, I'm sorry. Everything has, yes, BL has nerve thickening. There was an image in NEET PG where they give you nerve thickening here. Can you tell me which question is that? What is the nerve involvement here, from here to here? Okay, which nerve involvement? But most common nerve involvement is ulnar. Okay, but they gave an image from here to here. So which one is that? Great auricular nerve. Okay. See, Rachna, why would you say that? I'll tell you one thing. When I gave mock test, I never passed my mock test. Never, never. Okay, I never passed any mock test. So when I hear people getting 200, 210, 260, 150, 140, I got 129, I think. That was the first score that I had. And the last, okay, I passed one mock test, which was a PYQ test. I got 260 in that. That was PYQ. तो उसमें 260 लाके क्या उखाड़ लिया? The base is that mock tests are very tough. Okay. Plus, I'll tell you one thing. Just give me 2 minutes. I'll tell you this. I never passed a mock test, and I scored this much in my exam, and it was the toughest exam. तो ऐसा कुछ नहीं है, ठीक है? ऐसा कुछ नहीं है. Mock test में if you get 140 also, it is good, because see, your mock test, if you give it very seriously, it will decide. But many people are not serious. सब ऐसे ऐसे करते हैं. So don't take it seriously, okay? So yeah, again I'm showing you the images: satellite BT and annular TT. Okay, how do you divide it into possibacillary and multibacillary? And this is the saddle nose deformity. So possibacillary 1 to 5 nerve skin lesions are seen, and prepladder shit, नहीं लेते नाम, कब सीखेगी सारा? ठीक है, तो any app, remember the questions are made by the machine, so they are very tough. Okay, they are very tough. So, and some questions are very irrelevant. Okay, वो आते भी नहीं है, दूर से भी नहीं आते, तो don't worry about that. All right. Okay, so yeah, so 1 to 5 lesions and 6 or more. So posse and multi, and nerve involvement is no to 1 nerve involvement or more than 1. And what is the drug of choice? Remember, these 2 drugs for 6 months in possibacillary, and these 3 drugs for multibacillary. Okay, these 3 drugs for multibacillary. Okay, चाय मतलब बिस्किट कब कौन से जमाने में खाया मैंने? तुमने मुझे मीठा खाते हुए देखा, तो फिर बिस्किट क्यों लेकर आए? हाँ, कोई नहीं, मैं बहुत मीठी हूँ, मुझे कोई मिठास नहीं चाहिए जिंदगी में. थैंक यू. तो हेलो फ्रेंड्स, चाय पी लो. Yeah. Okay. So this is what 6 months. So what have we discussed? Let's just revise. No. 2 drugs are given for possibacillary, which is dapsone, rifampicin, and 3 drugs are given for multi. Okay, multi. All right. Now look at this question. We are going towards psychiatry. थोड़ा psychiatry भी कर लेते हैं. Yes, from FMG and NEET, because I am giving NEET ना, तो I will do NEET PYQs ना. मतलब मुझे रैंक लाना है ना. That's why I remember all the PYQs now. See, a student is always better than a teacher because you are actively studying. Okay, so I am actively studying because still student हूँ. तो जब तक student हूँ, जब तक याद रहेगा. Alright, so yes, a girl suspects that the college principal is making some conspiracy against her, planning to fail her she feels that other teachers have joined the conspiracy as well. What is the most likely diagnosis? Yes, it is delusion of persecution. Okay, so that is the most common. हाँ हाँ इसमें नीट पीजी के भी है. Okay, most common delusion is your delusion of persecution, where you feel like the whole world is against you. Okay, and what about delusion of infidelity? Othello, they are one and same. Remember, this is a jealous, very morbid jealousy. Okay, और ये मतलब जो होता है ना, मैं बहुत possessive हूँ, keep your possessiveness in your मतलब घुसा लो अंदर, because it's I've seen the cases of morbid jealousy, और भाई single रहना better है. Okay, don't do that. Don't be so toxic that you start thinking that the person is cheating on you and all that. So it is caused usually in alcoholics, and they have this belief कि उनकी wife उन पे cheat कर रही है. Okay, yes. Peeping Tom. Yeah. Yes. I will pass is bar, dos par, is bar, dos par. Okay, so this is morbid jealousy, thinking that the wife is cheating. All right. Ma'am, आप हाइट आ जाओ. This time we will have Nilofer Cafe. Okay, we will go to Nilofer Cafe. Right? So look at this question. So this question was asked last time also. They gave hands. So these are my hands. You can see कितने प्यारे hands हैं मेरे. And सुनो ना, मेरे पैक में चार्जर है, वो लेकर आना. So these hands, they will show you, and this is an obsessive compulsive disorder. While the thoughts are so disabling that unless you go and wash your hands, you will not be able to do anything else. So this is, yes, this is OCD. So that's why they have so much compulsion that they keep doing. What about panic attacks? Can you tell me the symptoms of panic attack? Can you tell me the symptom of, yeah, they gave a picture of wash basin. ठीक है? And they asked, what is this associated with? So yes, it was associated with, yes, very good. Yeah, so panic attack will have those symptoms where you have sweating, palpitations, right? Palpitations, and feeling of impending doom. That is very important. Feeling of impending doom. You feel like something is going to, yeah, feeling of impending doom, right? Sweating. Then agoraphobia is the fear of, tell me, jaldi. Generalized is free floating anxiety. So it is like, panic attack is like, now, did you see Rachna? Rachna को हो रहा है panic attack. Like, ma'am, should I quit now? और अचानक उसकी धड़कन तेज हो गई, and she's worried about that. So yeah, that happens. Heart rate increases, sweating, feeling of impending doom. What about PTSD? What is the difference between PTSD? PTSD, you remember, there is, yeah. So it is fear of open spaces. Very good. It is fear of open spaces. And somebody asked about PTSD. So in PTSD, remember, so there was a question. Okay, there was a question जिसमें दिया था, a patient had sweating, palpitations, and then he had a history of COVID-19. So what is the diagnosis? Okay, can you tell me what is the diagnosis for this? Is it PTSD or is it panic attack? Just choose A or B. Okay, can you tell me this? A or B? Is this PTSD? Remember, this is panic attack, okay? Look at the symptoms. If they give you symptoms like flashbacks, wakes up screaming, this patient has gone through a traumatic event, okay? Traumatic event can be anything. It can be rape, it can be having an accident, losing a family member, okay? A traumatic event, life-changing event, plus symptoms like flashbacks, hyperarousal. Hyperarousal, matlab, हाइपर अराउजल मतलब एवरी सिंगल वॉइस, लाइक दिस फॉलिंग डाउन, ठीक है, दिस आई विल बी लाइक दिस, ओके, तो दैट इज हाइपर अराउजल. प्लस they will be away from you, they'll stop talking. So what is that symptom? They'll stop talking, they will keep to themselves, okay. So yes, trigger associated with trauma. And I had PTSD, so it is not like panic attack, it is very scary, right? Very scary. So remember, flashbacks, hyper arousals, nightmares, bhai sahab, very bad nightmares, okay. So think of the symptoms, whether they give you a life event. If they tell you palpitations, sweating, fear of impending doom, that is panic attack. If they give you symptoms like you have a very big event plus what do you say, flashbacks, nightmares, hyperarousal, as well as, yeah, avoiding, yeah, very good, very good. So generalized, remember, it is free floating anxiety. What do you mean by free floating anxiety? आज एग्जाम के बारे में, अरे कल एग्जाम है, अरे मेरा खाना खराब हो गया, अरे मेरी बाई ऐसी है, अरे मेरे मम्मी पापा, अरे, तो दैट इज फ्री फ्लोटिंग फ्रॉम वन टू अनदर. What should I do PGN? So I am very, very, very good with kids. So either pediatrics or OB-GYN. Okay? Do you think I will make a good pediatrician? Do you think I'll make a good OB-GYN? I'm very close to women and children. So one of them. ठीक है. हाँ, okay. So this symptoms are persistent on, also remember, more than 6 months. अगर 1 महीना है तो you will not tell that it is the diagnosis for that. And free floating anxiety, restlessness, inability to relax. And what is the treatment of choice? Yes, it is SSRI. Okay, SSRI, okay. SSRI. And OCD, you already know, it is an obsessive compulsive disorder. Now look at this question. This is a very good question. Actually, I changed it recently. Surgery is very male dominant, and surgery matlab, see, you do general surgery. General surgery में घंटा आपको कहीं पर मतलब कुछ भी नहीं होगा, आपके लग जाएंगे. उसके बाद you have to do MCH. तो 6 years में मराती रहूँ, मतलब पढ़ती ही रह जाऊँ मैं जिंदगी भर. So I don't want to do that. I'll do MD pediatrics या OB-GYN and then I'm done studying. उसके बाद मैं नहीं पढ़ूंगी, बस हो गया मेरा, खत्म. Okay? अरे हेक्सा, thank you so much, thank you so much. I love surgery actually. I was very good with my hands. ठीक है, अगर आप मुझे देखते ना, I was amazing. But the problem is future भी, अभी I'm older, right? तो वो जोश थोड़ा कम होता जा रहा है. I want to do other things in my life also. I want to get married. I want to have kids. I want to go out, enjoy. ठीक है. So yeah, what is the answer? So many people have very good Logan, you become a psychiatrist. I'll become, मैं पागल हो गई, मतलब मुझे जब भी स्ट्रेस होगा मैं आपके पास आऊंगी. हाँ. So this is, so a woman getting difficulty in sleeping at night, she says that she gets thoughts that her parents may die in the accident. She similarly has many other worries. She has shifted alone away from parents 7 months ago. So what is this? What about adjustment disorder? What is adjustment disorder? See, 6 months is this. Adjustment disorders is 3 months. ठीक है? OCD is, yeah, very good, very good. 3 months में it goes by itself. Adjustment is feeling a little bit low, but not exactly depression till because of normal activities like breakup. ठीक है? breakup की वजह से छोड़ दी मुझे भाई मैं, and then you, so that is adjustment disorder, adjusting. Okay? And then you have bipolar में याद रखना. What is the drug of choice for ADHD? ADHD. Can you tell me the drug of choice? This was asked recently. Okay? Vikram, adjustment disorder, लड़की ने धोखा दे दिया? Yeah. Methylphenidate, very good. Methylphenidate, okay. ये drug of choice for. And what is the drug of choice for depression? Depression again. Now look at this question. Tell me the answer for this. A 37-year-old man reports that after suffering from certain financial loss, he developed certain symptoms. He started feeling fearful that someone is about to harm him. He could not sleep or eat properly. He also began to hear voices of a female. So what is the difference between illusion, delusion, hallucination? Can anybody tell me this? Illusion is where there is a stimulus, presence of stimulus is there, but you are interpreting it differently. Like if I tell about this charger, this is a stimulus, but to me this looks like a snake. अरे देखो सांप मेरे हाथ में है इतना. I hate snakes, man. Yeah. So that is illusion. What about hallucination? Negative stimulus, but you can see that person. Okay. And what is the most common hallucination? What is the most common hallucination? What is the most common hallucination? It is auditory. Auditory hallucination, which is most commonly seen in schizophrenia. Schizophrenia से एक question पक्का है, ठीक है? Very good, very good. Okay? And delusion is a fixed, false, firm belief. Firm belief. ठीक है? So, is believing in God a delusion? Can I ask you that? Is it a delusion to believe in God? Fixed form, firm belief. तुम कितना भी बोलो वो बोलेंगे नहीं भाई है, नहीं भाई है, कुछ तो है, कुछ तो है. Is that fixed form, firm belief? Remember, no. Culturally accepted is not a delusion. Okay? Culturally, tactile hallucination and cocaine. Cocaine. Okay, we have a question on that. Okay? So just go through this. This is the explanation. Tell me about this one. Yes, yes, very good. All right. Tactile cockroach. No, ma'am. क्या no, ma'am? अच्छा. Delusion is accepted by social norm. See, culturally accepted. Something that is culturally accepted is not a delusion. Social norms may accept. मतलब, how is it? Have you met a delusional person? नहीं करते कोई भी accept. मतलब ज़्यादा हो जाता है, ठीक है? So this is about his serotonin, SNRIs they are talking about. So we are talking about depression. Depression, what is the drug of choice? What is the drug of choice for depression? It is SSRIs. Here, your SSRIs, just go through this. This was the theory part, okay? And just remember, TCA, we avoid them in cardiac patients. This was a question that was asked. TCA से ये question आता है, okay? So these are, हाँ, तो I'll tell you. So they, in depression, what is the etiology of depression? There is decrease in what? Serotonin levels. Okay, there is decrease in serotonin levels and we want to increase the serotonin levels. So to increase, it's better to have a selective one rather than the non-selective, because non-selective will then, you remember your pharma, non-selective में क्या होता है? They increase noradrenaline also. Noradrenaline is involved in increasing your heart rate, increasing your, because what? It will stimulate the beta receptors, right? Receptors, physio, pharma, ठीक है? So that's why they are avoided in cardiac patients. And what are the examples? Milna, Velna, Dulna. Dulna, Velna. मिलना डुलना मिलना मिलना डुलना मिलना, ठीक है? मिलना फिर डुलना फिर मिलना. ओके, so they are SNRIs. SNR, okay? SNRIs. One, What about your TCA? Amipramine and amitriptyline. They are the examples of TCA. Okay, tricyclics. Right? They are avoided in cardiac patients. Which are safe in cardiac patients? SSRIs. And what are the SSRIs? These are the examples: fluoxetine, paroxetine, sertraline, citalopram. They are used from mild to moderate depression. Your sertraline is the drug of choice postpartum depression. Okay? Cardiac patients, and they increase only serotonin levels. And we also have this depoxetin, which is involved, which can be given for, which is a drug of choice for premature ejaculation. Premature ejaculation. Is the voice breaking? Is the voice still breaking? Let me just check if the voice is breaking. Hello. Hello, मेरा काम ही नहीं कर रहा. Okay, now it's okay. Because I'm moving a lot. Okay, what is the drug of choice for restless leg syndrome? Hello. Yeah. Restless leg syndrome, what is the drug of choice? What is the sertraline? Okay, sertraline is the drug of choice for postpartum depression. What about your drug of choice for gabapentin? Gabapentin is the drug of choice for restless leg syndrome. Before we used to say pramipexole and ropinirole, which is the drug of choice for Parkinson's disease, but now it is gabapentin. Okay? Gabapentin. If you don't see gabapentin an option, then choose pramipexole. Okay? So depoxetin is a drug of choice for premature ejaculation. Tell me this question, the answer for this also. Again, what did we discuss? Let's rewind it again. SSRIs are the drug of choice for depression. Okay? Drug of choice for panic attack is also SSRIs. Okay? But if you want symptomatic relief in panic attack, you give benzodiazepines. Okay? Like, tell me an example of a benzodiazepine. Tell me. Okay? And restless leg syndrome is gabapentin. So SSRIs for depression, we have to reduce the serotonin levels. So SNRIs actually increase both serotonin levels as well as noradrenaline levels. SNRIs, the examples for SNRIs are Milna, Dulna, Velna. Okay? And then we have TCA. Again, they are avoided in cardiac patients. Amitriptyline and amitriptyline. So these two drugs are avoided in cardiac patients because they increase heart rate, BP. Okay, they are not safe for cardiac patients. Which are safe? Your SSRIs. What are the examples? Citalopram. Then you have sertraline, you have fluoxetine, you have duloxetine, and then you have depoxetin. Depoxetin is a drug of choice for premature ejaculation, and premature ejaculation is ho gaya. Okay, this is premature ejaculation. Okay, what is premature ejaculation? All right, so less than 1 minute, मतलब गया और खत्म. All right, so I always do this. See, very nice, no? This is your premature ejaculation. What is this? 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 This is your radial wrist drop. Okay, your dirty mind. Stop thinking like that. But sildenafil. And then sildenafil ke sath, what do you never give? Nitrates. Okay. All right. So this is 1 minute. Very good. Very good. Erectile dysfunction. Yeah. What about this one? Which of the following is not a symptom? All right. So what is this? Suicidal thoughts is actually seen in depression. Okay, they are seen in depression. While not a symptom of panic attack see, they have a fear of impending doom. So they are scared of death. They are scared of death. All other symptoms are symptoms of panic attack. Okay? And this question again asked repeatedly so many times. Okay? So alcohol withdrawal is a very, very, very important topic. Very, 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 very important topic. Yes, mimics MI. Very good, very good. Yes, it is the most common symptom of alcohol withdrawal or nicotine withdrawal, smoking withdrawal. The first symptom is tremors, okay? And that's the symptoms for Parkinson's disease as well. So what happens with alcohol withdrawal? It is actually withdrawal, okay? So first in day one, what do we have? Around 8 hours. In around 8 hours, you will start having withdrawal symptoms like irritation, you will have tremors, nausea, vomiting, okay? All these symptoms are withdrawal symptoms that you face in the first 8 hours. This day 2 or less than 48 hours, what happens? What happens? There will be not delirium tremens, there will be seizures on day 2. Which are the most important seizures? GTCS. What is the drug of choice for GTCS? Okay, what is the drug of choice for GTCS? Yes, and you have yes. Hallucination. Yeah. Valproate, sodium valproate. Now, with respect to sodium valproate, you remember the theory? It is the most teratogenic. Okay? We will discuss about this more. GTCS, and after 48 hours or day 3, if they tell you. Okay? If they tell you day 3 or more than day 3 or more than 48 hours, that you will have delirium tremens. Okay? Delirium tremens. All right? Very, very important. And here, what kind of hallucinations will you have? The most common hallucination is auditory. But here, what kind of hallucinations will you have? Yeah, tactile cocaine में दिखता है. Here in delirium tremens, you will have visual hallucination. Visual hallucination, ठीक है? Delirium tremens में. Okay? Less than 48 hours, you will have hallucination also, which is auditory, and seizures, GTCS, ठीक है? Okay, very good. What about this one? See, many people were telling this. I brought this question for you. Lithium. A most common emotion doesn't matter. एक बार आया था, मेरे एग्जाम में आया था. Okay, it came in my exam. That thing, the most common emotion. So whether it was, many people wrote fear, many people wrote joy, many people wrote love. But I saw in a meta-analysis. Okay. Meta-analysis, I searched a lot क्योंकि मुझे आंसर चाहिए था. तो in a meta-analysis, what is a meta-analysis? PSM जाओ वापस. What is a meta-analysis? Tell me that also. It said joy was the most common. ठीक है? Joy was the most common. Fear, अब देख लो, joy was the most common. And love सबको नहीं मिलता, कटते भी हैं. ठीक है, बीच वाले भी बहुत लोग हैं. See, I'll tell you best analysis. Yes, you have this mountain, right? It is divided. Your meta-analysis is the gold standard. Meta-analysis. It is the gold standard. Okay? The best study. After that, what do you have? Systematic reviews. Systematic review. After that, you have which one? RCT. Okay? So these are your studies in PSM, right? Okay. Can we take a break? Can we take a break for 15 minutes? I need to go to the washroom. ठीक है? क्योंकि सुबह है. Can we take a break? We will do this question after we come back. Yes. Can we take a 15 minutes break? Okay. 11:15 we will start. I'll just go to the washroom and come back. यस 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 यस, थैंक यू थैंक यू थैंक यू। बी बैक, ओके? ऐसा नहीं कि 15 मिनट मतलब तुम चले ही गए। कम बैक, कम बैक। 15 मिनट्स। ओके। Hello. Everybody back from the break. Back. आ गए वापस? Yes, okay. So this is yes. Hello, ma'am. Hello. Yeah. So see, time की पाबंद सारा खादर. Right. Where is my pen? Yes, I got my pen. Chalo. Let's revise. So, hello. Yeah. So can everybody message in the group that we have started again? Zubran, class hasn't ended. This is Epstein anomaly. Very good. Lithium, if given, it causes box-shaped heart. So it causes atresia of which valve? Which valve? Heart. And NTDs are caused by NTDs like anencephaly. You remember anencephaly, right? So to prevent NTDs are caused by which drug? Can you tell me? Yes, tricuspid atresia. Very good. NTDs are caused by which drug? Valproate. Yes, sodium valproate. Okay? And to prevent that, we give folic acid. So folic acid is given. How much is it given? 400 mcg is given for a female. 400 to the tablet comes in 500 form. तो जो भी आपको बेस्ट लग रहा है आंसर चूज दैट. ऑल राइट. 4 mcg micro, okay? 400 mcg, not mg. And 4000 mcg, it is given to a new female, a female that doesn't have history of any NTDs, okay? What about your history, female with history of NTD? You give 4000 mcg. All right. So this will be 0.4 mg and 4 mg. Okay. So this question has also come asked many times. And remember, yeah, I've written it down. Yeah. This is your box-shaped heart. It is caused by tricuspid atresia. And I've written it down here also. Okay? Okay. This will be there for till 1 p.m. Right? We can do till 1 p.m. Right? Yeah. TOF is box-shaped heart. TGA is which heart? TGA, TAPVC. Which hearts are those? Yeah, very good. This is scratch mark all over his hands. Tachyarrhythmia. These are nothing but tactile hallucination. What are tactile hallucinations? So they are hallucinations jo you will feel like scratching, scribbling. Why? Because you feel like the bugs are crawling on your hands. Okay. Snowman is TPVC, figure of 8 TAPVC, and egg on string or egg on side is TGA. Very good. Cockroach. Also, remember they have a jet black tongue. So this was asked in NEET PG 2018. All right. Okay. Cocaine bugs. We call them as cocaine bugs also. Okay. Tactile cocaine bug. Jet black tongue. And can you tell me, cocaine, what does it cause? Mydriasis. Pinpoint pupil are seen in. Pinpoint pupil is seen in. And cleft palate, you remember? Yeah, cleft palate is associated with trisomy 13. Right? Yes, okay. Opioid poisoning. Very good. This was the question. Jet black pigmentation of tongue, with it is seen in cocaine. Alcohol, cannabis sabko pata hai, joint. So one question that was recently asked was about during Holi, something was mixed with milk. What is that? That question was given in a clinical scenario and it was a big long question. Okay? But basically that was the question, and remember it is bhang. Yes, bhang. Okay? Look at this question now. Look at this question, very important. 16-year-old female was referred for irresistible urge to eat, followed by episodes of self-inducing vomiting. her weight is normal, the patient is also on appetite suppressant, what is the most likely diagnosis? So this is, yes, urge to eat, induce of self-vomiting. Remember, self-vomiting is also seen in anorexia. Vomiting, self-induced vomiting is also seen in anorexia. But you have to decide on the basis of weight. So normal to overweight is seen in bulimia nervosa, okay? Binge eating also. Binge eating is seen in obese. And anorexia, remember, the weight is very normal. Weight is low, okay? The BMI will be less than 17. All right, anorexia, the patient will eat less, plus what will be the thing? The weight. Think of the weight whenever you have. Loss of appetite is there. Anorexia is, I told you, no, GnRH also reduces. So menstrual cycle disturbances are there. Plus she is fearful of eating. So she will be eating very less and doing a lot of exercise. And her BMI will be less. Okay, she will be underweight. Underweight. Remember this. Bulimia, the weight will be normal or overweight. Binge eating will be obese. Okay, binge eating will be obese. I told you, no, bulimia, it will be normal or overweight. Anorexia nervosa will be underweight and obese will be binge eating. Okay, remember that. Now this, you asked me a question related to pregnancy. So this is a question related to pregnancy. Tell me, a pregnant female presented with burn in maturation, a diagnosis of cystitis was made. Which of the following drugs will you use for the treatment? Which of the following will you use? Yes, very good. You will use amoxicillin. Why not ciprofloxacin or doxycycline? Because what drugs, antibiotics are safe? PCM. What are PCM? Penicillins, cephalosporins and macrolides. Cephalosporin and macrolide. And these are all the drugs that you have to remember for pregnancy. Okay. So let's do it together. What in hypertension? What is the drug of choice? What is the drug of choice? So drug of choice is labetalol, which is a beta blocker. And which drugs are absolute contraindication in hypertension? They are ACE and ARBs. ACE and ARBs are contraindicated. The drug of choice in hypertensive emergencies is also hydralazine, and labetalol is the drug of choice. हाँ मिल जाएगा PDF. Okay, and methyl dopa is a alpha blocker, right? Alpha, which one? Which blocker? ठीक है. And then you have hydralazine, prazosin, clonidine and amlodipines. Okay, these are the drugs which can be given. Hydralazine is the drug of choice in hypertensive emergencies, while labetalol is the drug of choice in pregnancy. Anti-epileptic drugs that are teratogenic, the most teratogenic is sodium valproate. Which ones are safe in pregnancy for epilepsy? Which ones are safe in pregnancy in epilepsy? So that would be levetiracetam and lamotrigine. In between these, can you tell me which one will you choose if they ask you? Between this lamotrigine and levetiracetam, which is the drug of choice if you choose? Which is a better drug actually, not drug of choice, both you can give. Yes, levetiracetam, okay? Levetiracetam more than lamotrigine, right? Very good, very good. So anti-epileptic, the most, what do you call it? Teratogenic is sodium valproate. Levetiracetam and lamotrigine are the least teratogenic, so they can be given for epilepsy. Okay, levetiracetam more than lamotrigine. Warfarin is teratogenic again because it causes warfarin fetal syndrome, and we avoid it in the first trimester. So the question that comes is, what do you replace it with? So you replace it with heparin. Okay, you replace that with heparin. PTU is the drug used for hyperthyroidism in the first trimester. In second and third, we use methimazole and carbimazole. And all first-line TB drugs are safe in TB, in pregnancy. all the first line. So we have HRZE. What is HRZE? What is HRZE? You have isoniazide, ethambutol, pyrazimide, and yes. All right. And the injectables we don't give. They are not allowed. Right? So first line TB drugs are safe. And you know, drug of choice for malaria and pregnancy is chloroquine, which causes bullseye maculopathy. Okay? Which causes bullseye maculopathy. You remember this? Again, can we, and you can see this was the question. This was the question related to PT, what do you say, warfarin, right? So again, what are the drugs? When we talk about hypertension, which is the drug of choice? Labetalol. Hypertensive emergencies, hydralazine. Then which are contraindicated? ACE and ARBs. For anti-epileptic, which one is the drug of choice? Levetiracetam and lamotrigine. Levetiracetam more than lamotrigine, which is contraindicated, absolute. Sodium valproate, which is the most teratogenic. Then you have warfarin and heparin. Warfarin is avoided, we give heparin. You have PTU in the first trimester for hyperthyroidism, and carbimazole and methimazole for second and third. And then all antimicrobials are contraindicated except PCM, which is penicillin, cephalosporin, and macrolides. And the last one is TB. All first line TB drugs are accepted, except for your injectables and all the other drugs. TB, MDR, XDR, please go through it, very, very important. And then chloroquine for malaria. It is the drug of choice. Okay? Which causes bullseye maculopathy. So the answer for this is you change warfarin to heparin. Okay? You change warfarin to heparin. Very good, very good, very good. Sorry. What is this? Again, this has been asked so many times. So many times, I can't even tell you. It has been asked multiple times. What is this? Yes, this is your pellagra. Okay, pellagra. What is it? It is a photosensitive. Okay, photosensitive dermatitis. And there are 4 Ds there. Which are the 4 Ds? Your diarrhea, dementia. So the clinical question that comes is, a patient has come with diarrhea, dementia, forgetting things. Yeah, sun exposed areas. Yes, very good. And diarrhea, dementia, dermatitis, if not treated, ultimately leading to death. Okay, ultimately leading to death. Yeah, very good. So this is vitamin B3 or niacin. Vitamin B3, niacin, serotonin, and melatonin. All these 3 are derivatives from which enzyme? Can you tell me? Yeah. Can you tell me? Tryptophan, very good. Tryptophan, very good. Tryptophan. So there are other diseases which cause pellagra-like symptoms, and you know, this is your angulochlosis. This is riboflavin. About riboflavin, just go through this. They are coenzymes in complex 2 and 1 of ETC, right? And marker is glutathione reductase, while transketolase is the marker for B1, right? And the main thing you remember, angular stomatitis or chelosis. Angular stomatitis or chelosis is also seen in another syndrome. Can you tell me the syndrome where it is seen? Can you tell me the syndrome it is seen in? Angular chelosis, koilonychia, which is spoon-shaped nails, esophageal webs, and yes, Plummer-Vinson syndrome. Okay, Plummer-Vinson syndrome. Very good, very good. Plummer-Vinson syndrome. And what is seen? Esophageal webs, yeah, Peterson-Cali syndrome, right? Esophageal webs are seen. You have koilonychia. Koilonychia is also seen in iron deficiency anemia. Remember that? Yes, esophageal webs. Yeah. Okay. So these are the findings of Plummer-Vinson syndrome. Okay, spoon-shaped anemia, koilonychia, it is seen in iron deficiency anemia as well, right? And B6 is your pyridoxine. Again, B7 के coenzymes पूछे जाते हैं. So please go through these B enzymes, and they inhibit, like raw egg have deficiency because it contains avidin. So this was asked in 2017, long ago. Okay, long ago it was asked. So please go through this. Coenzymes are very important. Okay, coenzymes in which, yeah, very good. So they are involved in pyruvate carboxylation, in gluconeogenesis, fatty acid synthesis with acetyl-CoA carboxylation, and propenyl-CoA carboxylation in fatty acid metabolism. Okay, yeah. So this is biotin, and yeah, hair fall. They are used for preventing hair fall, right? Yeah, I've written it down here. Tell me the answer for this. So these are some biochem questions which are asked regularly. Regularly ये पूछा जाता है एग्जाम में. Yeah. Yes, very good. So this is burnt sugar urine odor, which is branch chain alpha keto acid, which is nothing but what disease is this? Maple syrup urine disease. Homogentisic acid, it is seen in homogentisic acid. Yes, isoleucine, leucine and valine, right? Branch chain keto acid. Yes, very good, very good. I've written it down here. Accumulation of leucine, isoleucine and valine. Okay. Homogentisic acid is alkaptonuria. So here what happens to the urine? What happens to the urine? On long standard it becomes black, right? It becomes black. Yeah, in the eye there is ochronosis, right? Phenylalanine hydroxylase is for what? And glucose 6-phosphate is for von Gerke. Okay, von Gerke, right? Phenylketonuria, very good. So the phenylketonuria has mousy smell, right? Mousy odor. Right, very good. So alkaptonuria, darkening of urine, homogentisic acid, dark spot and sclera, ochronosis, right? What about this one? Lish-Nyhan syndrome, very important. Lish-Nyhan syndrome, you remember it is self-mutilating disorder, and this is Hg, yeah, very good. Hypoxanthine guanine phosphoribosyl transferase, right? HGPRT, yeah. Just remember HGPRT. What about your Galput? Galput is for Galputin. Galactosemia, very good. Oil drop cataract, we did it yesterday. Sphingomyelin is Niemann. Glucose is Gaucher's. And galactosidase is sorry. So this is your Lish-Nyhan syndrome. Okay, remember this images have been asked. Remember this guy starts eating themselves or biting their lips. Okay, so this is a self-mutilating condition. Yes, that is Fabry's. So sphingomyelinase is Niemann-Pick. Remember the cherry red spot? It is seen in Tay-Sachs also and CRAO. Okay, and Gaucher's disease, glucocerebrosidase inside the cells, crumbled tissue paper appearance is seen. You remember the crumbled tissue paper appearance? I don't have the image, but yeah, it is seen in the cytoplasm. You remember that? And flask-shaped deformity is seen in the bones on X-ray. Okay. Fabry's disease is alpha galactosidase. Tay-Sachs is hexoaminidase A. Okay. Fabry and Krabbe. Yes, very good. Tell me about this one. Recurrent episodes of early morning lethargy, seizures. There will be lactic acidosis. Yes, very good. So remember lactic acidosis, recurrent and what do you say? Hypoglycemia. Okay. These two are associated with what? Yes, right away this is associated with von Gerke's, which is glucose 6-phosphatase. Okay. Remember these two words. Hypoglycemia and lactic acidosis. Early morning lethargy is because of the hypoglycemia, right? Got it? So glucose 6 phosphatase, and you already knows about these options, right? Very good. So recurrent, remember recurrent hypoglycemia, seizures, and this one. Can you tell me? These are some images we will do. ठीक है? What is this? Can you see? This is interstitial keratitis, Hutchinson's teeth, and SNHL. Okay, plus you can see dark field microscopy, and you can see spirochete, right? So this is congenital, the triad for Hutchinson's triad, या congenital syphilis. Congenital syphilis. Very good, congenital syphilis. Okay, Treponema pallidum. Okay, what about this one? Blue sclera. You can see the bones are fractured, so multiple bony fractures. What is this? Blue sclera, multiple bony fractures, plus also SNHL. This is osteogenesis imperfecta. Genesis imperfecta. Very good, very good. Osteogenesis imperfecta. It is seen in, yeah. And the deformity has COL-A1 gene. So this is seen in osteogenesis imperfecta, right? Osteogenesis imperfecta, also known as brittle bone defect. Okay, brittle bone disease. COL1A1 gene defect, right? Osteogenesis imperfecta. Okay, so this kid dies very early, right? What about this one? What is this? These are some pedia images. What is this? This is your Shakir's tape. So now tell me, what is SAM? What is SAM? You can see less than 11.5 is less than 11.5, right? Very good, Sanya, very good. Yeah, less than 11.5 mid-arm, yeah, it is used for mid-arm circumference. So less than 11.5 plus bilateral pitting edema, and SD should be how much? What is the criteria for your acute, severe acute malnutrition? Tell me the criteria. Bilateral pitting edema, the mid-arm circumference should be less than 11.5 and SD is 3, yeah, -3. Okay. Okay, very good, very good. So this one is actually a picture of a female who is autistic, okay? And this is an X-linked dominant disorder. She has autism, and it is known as Rett syndrome, okay? Rett syndrome, this was asked in 8 PG, right? Very good, very good. So can I go faster? Yeah. What is this reflex? What is this reflex? What is this reflex? This is your Moro's reflex. Moro's reflex. This is your Palmer reflex. This is your, okay, this is your rooting reflex and parachute reflex. Which one never disappears? Which one never disappears? ये कौन आ गया यार बोलने वाला? एग्जाम डेट हो गई एक्सटेंड. It's not extended now. One minute, give me 1 minute. It's not now. January, yeah, sorry. ठीक है. See, कुछ लोग होते हैं ना, कुछ लोग ऐसे होते हैं ना जो बीच में आ जाते हैं. Like you remember that cat who comes and suddenly ऐसे करके then she looks at you and then she goes back. She's like, हाँ मैंने disturb कर दिया. So yeah, anyway, this is your parachute. These are your reflexes. Okay, these are your reflexes. Which one doesn't disappear? It's your parachute reflex. Okay, what is this? Kangaroo mother care. Okay, kangaroo mother care. It is done for preterm babies, right? It is done for preterm babies. What about this one? Anybody can tell me what this is? Yeah, KMC, preterm babies, direct skin to skin contact. And the criteria, please go through the criteria. Okay. Yeah, low birth weight. Preterms are usually low birth. Okay, preterm, low birth, LBW. Okay. Kangaroo mother care. What about this one? Anybody can tell me what is this? Can you see ground glass opacity? Can you see ground glass opacity plus this membrane, pinkish material, which is hyaline membrane disease? Very good. Hyaline membrane disease. Okay. Ground glass opacity on X-ray. Also seen, ground glass opacity is also seen in COVID, right? Disease, right? Very good, very good. So what about this one? Anybody can tell me what is this? Dome sign plus football sign. Football sign. Okay. So you can see air is white on, air is black on X-ray, and the dependent areas of the abdomen have air in them, right? And because of that, the air circulating all around, it actually becomes the shape of a football, which is seen in massive pneumoperitoneum. Very good. Pneumoperitoneum. Acha, pneumoperitoneum. Very good. Pneumoperitoneum. पे क्या क्वेश्चन आता है? Can you tell me the question that comes in pneumoperitoneum? And one question is sure from pneumoperitoneum. Always they ask. What about this one? You can see the contents of the intestines basically are in the mediastinum or thoracic cavity, which is hernia. This is congenital hernia, right? Congenital, which is the most common is which one? Bogdelic. Bogdelic is posterolateral, Morgagni is right anterior, right? Yes, very good. So pneumoperitoneum, remember, you will be able to see air under the diaphragm. Should I show you the radio images? What about this one? This is actually GCT has soap bubble appearance in the radial side, right? While your soap bubble appearance in the abdomen is seen in necrotizing enterocolitis. Okay? Nematosis intestinal, right? Can you see it is, what do you say, soap bubble appearance. So this is just an image. Just remember necrotizing enterocolitis. It is seen there. Okay? Gas in the abdomen in such areas. All right? So what about this one? This is because of a disease where you have all these lesions which are perianal and perioral. Okay? So this is acrodermatitis. Dermatitis enteropathica. So you give zinc here. Okay, zinc. This is because of zinc deficiency, right? Very good, very good, very good. This is because of zinc deficiency. And what do you give? Zinc supplements. Okay? So direct image, spot IBQ, right? What about this one? I told you cleft palate is associated directly with what? Cleft palate is associated with trisomy 13. Okay, trisomy 13. What about this one? This is your rocker bottom feet. You can see bottom feet, and this is trisomy 18. Right? Now this is a karyotyping, and you should be able to read the karyotype. So how many chromosomes do we have? How many chromosomes? We have 23 pairs of chromosomes. 22 are homologous, one pair is sex chromosomes, right? So this is your, which one? They are pairs, in pairs. And you can see, just look at the pairs and you can see that on 18th, there is 3 instead of 2. So this is Edwards, right? What about this one? You can see that here on 13, we have 3. So this is trisomy 13, which is patao. 13 साल की लड़की को नहीं पटाते, right? Okay, good. What about this one? You remember this one? What can you see in the image? You can see the webbed neck, wide spaced nipples, shield chest. Okay? शील्ड चेस्ट जो मेरा भी वैसी ही है जो चाहिए था वो मिला नहीं ठीक है या सो शॉर्ट फोर्थ मेटाकार्पल ठीक है her short fourth metacarpal and she will have a shield chest, web neck, short stature and what is the investigation of choice? Remember, gold standard or investigation of choice will always be karyotyping. ठीक है, karyotyping. So she will have a normal IQ. Where is the IQ affected? Yeah, bicuspid aortic valve. Very good, very good. Very good. Bicuspid aortic valve. Okay? अरे यार जोक मार दी, मतलब जोक मार दी तो आप ऐसे ऐसे देखोगे तो नहीं है, तो नहीं है नहीं है, छोटे है, क्या करे, मर जाए क्या करूं, छोड़ दू जॉब. हाँ, where Nunan has IQ issue. Okay, Nunan has IQ issue. What is this now? This is trisomy. Sorry, this is 47XXY. This is your Klinefelter syndrome. What kind of question comes from this? What kind of question comes from this? You remember the questions related to this? There is gonadal atresia. So this guy will have loss of secondary sexual characters like sparse hair, there is no hair present, gynecomastia, plus, yeah, infertility is seen in both. Okay, gonadal atresia. ठीक है, gonadal atresia. And then what, there is a bar body, presence of bar body. Remember about this, there are streaky ovaries. Okay. What about your, there's another syndrome, right? Yeah. What about this one? What is this? This is your, yeah, bar body present. You remember hypogonadism, gonadal atresia, 47XXY, and there is, this will be a tall male with gynecomastia with presence of bar body, right? Okay, very good. This is Hinosh-Schollen purpura and this is your palpable purpura. Very good. Palpable purpura. Okay, palpable purpura. IgA vasculitis, most common cause of vasculitis. Okay, vasculitis. There is abdominal pain. कहाँ गया मेरा? Abdominal pain. And what else? Abdominal pain, palpable purpura, and IgA vasculitis. Okay, this is the triad. HSP. Okay, what is the difference between purpura and erythema? If you take a glass slide and you put it on purpura, will it disappear? Will it fade away? So purpura is non-blanchable. It will not blanch, and erythema will blanch. What about your, on blanching, you see apple jelly nodule. In which disease? If you put a glass slide, there will be blanching. And you will see this apple jelly nodule. Where do you see this? Very good. You see it in lupus. Okay? You see it in lupus vulgaris. Very good, very good. What about this one? What can you see in this image? You can see that there is conjunctivitis. This is actually mucosal involvement, that is the strawberry tongue. Okay, can you see hands and feet are red, and there is cervical lymphadenopathy. Okay, lymphadenopathy. Okay, erythema in the palms and soles. What is this? This is actually, yes, Kawasaki disease. Kawasaki disease का एक mnemonic है. Can you tell me the mnemonic? Yes, it is cream. ठीक है, it is cream. What is cream? Conjunctivitis, rash, erythema, adenopathy, and mucosal involvement in the presence of strawberry tongue. Now, strawberry tongue is also seen in which one? Which disease is that? Scarlet fever. So, strawberry tongue is seen in scarlet fever as well. How do you differentiate between scarlet fever and Kawasaki? Can you tell me? How do you differentiate? How do you differentiate? How do you differentiate? Very good. Differentiate with fever. Less than 5 days is scarlet fever. Okay. And then more than 5 days is Kawasaki. Remember this. This is very, very, very important. Okay. And which disease? Yeah, I showed you na crumbled tissue paper appearance. Crumbled tissue paper appearance. Yes, conjunctivitis, rash, erythema, adenopathy and mucosal involvement. All right. Very good, very good. This is your Gaucher's glucocerebrosidase. You can see massive splenohepatomegaly, right? Yeah, very good. And what is this now? What is this? This is also a very important question, very important finding. What is this? So we are almost going to 12 o'clock. Very good. You can see the heliotropic rash. See, this is the heliotropic rash. Okay, you can see Gottran papules, right? Gottran papules. So these are seen in dermatomyositis. Okay, dermatomyositis. Right? Heliotropic rash. And what about this one? Can you see which sign is this? This is your Gover's sign. Okay, where the child goes from down to up, right? DMD. Yes, very good. This is your Gover's sign. It is seen in Duchenne muscular dystrophy, right? Till what time do you want me to finish now? Should I finish? Okay, tata, bye. Yeah. Okay, so this is seen in Duchenne muscular dystrophy. What about this? We already did this. This is your rickets. Rickets, right? Rickets, and you can see the cupping, spraying, fleeing, right? What about this? This is the rachitic rosary. Rachitic rosary. Remember, rachitic rosary is non-tender. Non-tender. Okay? Non-tender. Non-tender. What about this one? Trident hand, short stature, and yes, scorbitic rosary is tender, right? This is your achondroplasia. I should publish a book, right? I was thinking I should make a book of triads as well as images like this and explain them. Yeah. So don't worry, Darshna. You, see, I will finish now. Okay, this is PDF is over. This is the last question. Can you see the butterfly? Can you see the butterfly? Sorry, my drawings are very bad. Butterfly vertebrae. So, and you can see the face is triangular. And can you see the skin? The skin is jaundiced. This is seen in Alagillae syndrome. Alagillae syndrome. Okay, jaundiced, triangular face, butterfly vertebrae. All right. So, yes, this PDF is done. Do you want me to just go through some more questions? Like, should I just open the PDFs and just go through fast SSA? Like one last hour where we are just going fast. Can we do that? For 1 more hour. And then you will have 1 break, 1 hour break. And then you will have the Maha chanting. Okay? Image based session. See, the problem with me is you saw na, I explain a lot. मतलब मेरी वो habit है. I will be like ऐसे क्योंकि मुझे याद नहीं होता. I don't remember if I don't explain. Okay? If I don't know the theory, मतलब ऐसे मेरे लिए क्या होता है पता है? अरे वाह मजा आ गया. I understood this, मजा आ गया. तो I remember it better. तो मेरा वो Maha chanting is at 2 PM, right? So this was the pharma PYQ. Do you want to go through this? पर 86 slide है यार. Prescription का सब कुछ पता है. Prescription का you remember how to do the prescription? Yeah. So what causes jaw elevation? Jaw depression. Which muscle causes jaw depression? job depression. Okay, we will do IBQs ना. ये again pharma is theory. Pharma is theory. But one question is here. Do you see? Can you see the slips? Yes. Jaw depression is caused by lateral pterygoid. Protrusion is caused by medial and lateral. Okay. Remember this again. What is this? Hereditary angioedema. It is the कौन सा factor involved है hereditary angioedema में? Yes, ACE inhibitors, lisinopril, right? Captopril, lisinopril. Yeah, which bradykinin is in. What factor is involved? This is due to there is hereditary angioedema, and this is due to a drug, right? Dry cough. Yeah. Okay. Can you tell me which factor is involved? मैं करूंगी. I will make a book. Like I'm planning to make a new book. Like PYQ तो करूंगी, but I'll make another book. Will you buy it? आप बताओ. Will you buy the C1? ठीक है. C1 hereditary C1 esterase. Very good. C1 esterase for hereditary angioedema. ठीक है. What about this one? This is actually your angioedema, which is caused angioedema and dry cough are your captopril and lisinopril. They are the, what do you call it? The what do you say? Side effects of your, what do you call it? ACE inhibitors, right? Okay. ठीक है. तो this was an image based question. मैं देख रही हूँ कौन सा. You remember the trials. Trials are very important. Very, 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 very important. First, phase 1, phase 2, phase 3, phase 4. Okay, let's do 1 hour. Nobody leave. 1 hour जल्दी जल्दी करते हैं. Phase 1, phase 2, phase 3, phase 4. You remember? You remember that? This is about thromboxane A. Okay, aspirin. It blocks thromboxane A. Right? Trials. I will. Yeah, and malaria you were asking. Malaria, you see. Artemisinin derivatives. Somebody was asking again and again yesterday. Let me do this one and I will tell you about trials. Okay, trials is very important again. Artemisinin derivatives are artemisinin, artesunate, artemether. Okay, so these are actually used for falciparum, Plasmodium falciparum. And you should remember ACT. Now, artemisinin, ACT derivatives are divided into what? Northeastern states and rest of India. So ACT is SPC, which is sulfadoxine pyrimethine. That is used for the rest of India, while LM is used for northeastern. Okay, तो NE में M होता है. I remember it like this. NE northeastern में M होता है. Okay, LM, and SP is in rest of the India. Right? ACT is for both. Okay, so chloroquine, bullseye macropathy, I told you this is the drug of choice. And Wale and Vivax, again, what is the drug of choice? Chloroquine. Okay. Pneumonia, yes, I should have done pneumonia, na? So anyways, मुझे ढूंढना पड़ेगा यार. That is the problem. Tell me, should I show anything? इसमें क्या? Okay, just go through the drug of choices. I'll just, till then, can we just go through the images once? You remember this? ठीक है, I'll just show you. This is your juvenile polyp. Okay, it is an adenomatous polyp, right? Juvenile. I told you what is the what do you, juvenile polyp, what happens? There will be rectal bleeding. It is less than 5 years. Okay, less than 5 years. Less than 5 years. MDR treatment. Okay. What about this Wiskott-Aldrich syndrome? We did this. These cells, they come. Okay. So these are your white blood cells, right? पोल लगवा लीजिए और सारे टॉपिक्स. ओके. मॉस्किटोस हमें कहाँ से ढूंढूं? ओवरवेलमिंग है थोड़ा ऑल दिस. ठीक है, आई एम जस्ट टेलिंग दिस वन. what do you want to do? Jaldi bolo, someone tell me. We will do images, but okay. Should I continue? Should I continue? Yes, okay, okay. Okay, so this is your, you can see this is lobed. These are your neutrophils. This is your band-shaped neutrophil. The kidney shape is actually monocyte. While lymphocyte is what? Lymphocyte is this one, which has the biggest nucleus. Okay? Okay. What about this one? You remember this? ये बहुत important है. A male presented to the casualty after a road traffic accident. He was unable to speak in sentences. Okay. On auscultation as a resonant note for drug of choice, Paras made a video, right? Go and watch that. Okay. What is the appropriate management? So this is nothing but tension pneumothorax. Tension pneumothorax. ठीक है, ये भी एक short question है. Pneumothorax, and what do? In adults, we do needle thoracostomy with wide bore needle, and then you do ICD insertion in which line? Mid axillary line या anterior axillary भी बोल सकते हैं. What about this one? You can see in, what do you see on the X-ray? You can see that this one, the diaphragm has gone down. The diaphragm has gone down while the air cavity has increased in size and the lung has collapsed here. Can you appreciate the lung collapse here? Right? So there is tension pneumothorax, okay? It is one-way valve. What is this clinical feature? Dyspnea, tachypnea, increased RR. Causes are blunt trauma, again. One-way valve, air sucking, unidirectional, okay? Very good. And there is a mediastinal shift, the trachea shift to the other side, right? Very good. So this question is 100%. It will come. Tension pneumothorax. About pneumoperitoneum, we told pneumoperitoneum, you should see air under the diaphragm. Okay, I'll just show you some radiological images also. Okay, what about this one? Can you tell me? This one, what is this? A patient presents, a 57-year-old diabetic and hypertensive male presents to the casualty with left-sided hemiplegia. That means stroke kind, right? What is the most common diagnosis based on the CT scan? So you can see that this is a hypodense lesion. Can you appreciate that this is hypodense? Okay, I'm talking about this one, this image here. Okay. So what is this? Yes, this is because of ischemia. On a CT scan, how will blood appear? It will appear white. It will appear hyperdense. Okay? So this is due to ischemia, ischemic stroke. Okay? Ischemic stroke. What about your hypertensive bleed? Remember about the most common hypertensive bleed is due to hypertension, and it is putamen bleed. Okay? And this is your hemorrhagic bleed. You can see down here. This is your hemorrhagic bleed. While lacunar infarcts are very small infarcts, okay, in the basal ganglia. All right? Everybody with this? Yeah. And what about this one? You can see the boot-shaped heart. Boot-shaped heart. So this is seen in TOF, right? TGA is agon side, agon string, yes, side, and this is your 8, yes, snowman. And box shape, we just did it. Okay, and this, can you see this wound? This is an incision or laceration. This is an incision or laceration. Yeah, it has irregular margins, and it almost looks like an incised wound, but this is a lacerated wound. Okay, this is a lacerated wound. For incision, we actually use sharp objects, while this is done by blunt trauma, your lacerations. Okay? Plus abrasions usually happen when you skid on the road, right? In RTAs, did you see I had abrasions here, right? Abrasions. Confusion bhi ho chuka hai mujhe. What about this one? You remember this? This is EDTA, right? EDTA. It is used for CBC, right? Okay, very good, very good. What about ESR? That is black. Citrate is blue. Red is your, which one? Clot activator, okay? And this gray is actually glucose, and one question comes for glucose in biochem. You remember NAF, okay? Sodium fluoride, fluoride inhibits enolase in glycolysis, okay? NAF, sodium fluoride, it inhibits glycol. All right, so this one, and look at this one. What is this? Can you tell me what is this? I'm not doing the question, let's just do the image. This is your battle. What is this? This is your battle sign. Yes, but battle sign, this is due to what? This is due to middle cranial fossa fracture, okay? And you see autoria, okay? CSF coming out of the ear, right? Battle sign. What about raccoon sign? Raccoon is seen on the eye, right? And CSF rhinorrhea, we have target cell, okay? You know all that. फिर एक और, this one everybody remembers. What is this? This is your, yeah, very good. What about this one? What is this? Which year PYQs do as many? Steeple sign, it is seen in croup or laryngotracheobronchitis. Yes, parainfluenza virus. Now it is streptococcus pneumoniae, and you remember this is anhydrosis. Ptosis is seen here, drooping. So that was Horny Pamela. What about this one? This is which maneuver? Which maneuver? This is your Leopold's maneuver. Okay, so there are 4 maneuvers in this, right? Yeah, sympathetic chain compression. Very good, very good. What about this one? Yes, this is your Pollex maneuver. Okay, this is your Pollex maneuver. That is the 3rd maneuver. Okay, so these are your 4 maneuvers. What is the first one? You will do fundal grip. Okay, on the top, fundal grip here. Then the second one is umbilical grip, which is you press from one side and feel the extremities from the other side. Okay, what is the 3rd grip? Pollex grips. And the 4th one is you go to the patient side. Okay, can you see this and this is different? This is from here, this is from this side. Okay, that is the 4th grip or pelvic grip. Okay, fundal, umbilical, so fundal, umbilical, pollex and pelvic. All right, everybody understood this? Everybody understood this? Again, I'll show you. See, the first grip is from here. Like as a doctor, I will go and grip it here. Okay, the second is push to one side and then feel the other side. The 3rd one is pollex. All right, and the 4th one is you go from this side and do here. Okay, pelvic grip. Okay? Okay, very good. And this is Kawasaki, we all know this. Okay? P anka, C anka, this is what? Zenker's diverticulum. You remember this is Zenker's diverticulum, right? Yeah, so this is actually a barium image and not thumb sign. No, this is not thumb sign. This is not an X-ray, na? This is a barium image. Okay, this is barium. And what do you do in barium? Yeah, hypersensitivity and triads. Okay, let's open patho. We will do that. Yeah, so barium, you know Zenker's diverticulum, it comes out of which pouch? Which muscle is involved? Inferior constrictor. Which are the 2 muscles? There is a small space in between the inferior constrictor. They are formed by thyropharyngeus and cricopharyngeus, right? Thyropharyngeus and cricopharyngeus. Very good, very good. So remember this also. And then, yeah, this was what I was talking about, which is very important. Can you see this is the diaphragm? This is the diaphragm. and can you appreciate that there is air under the diaphragm? Okay, air under the diaphragm. So in such a patient, air is coming from the intestine. So the intestine might be ruptured, or there can be a perforation or ulcer, a ruptured ulcer. So it is due to a perforation that the gas has come in the dependent area, which is under the diaphragm. And what will you do? You will find the perforation by doing the exploratory laparotomy. Okay, exploratory laparotomy, right? So I'll just open patho now. Patho आपको वो चाहिए था ना? Yeah, hypersensitivity. See, these are some of the these are the tumor markers. ठीक है? Tumor markers and bony metastasis, very, very important tumor markers. Okay, we can see everything that increases. Everything is here. No problem, doctor, I had this, it's fine. Everything is here. Just go through the tumor markers. This is the last. मतलब अभी एक बार देखना है, याद रखना है. Prostate cancer, you know not, osteoblastic. The other question that comes from prostate cancer is treatment with iodine. How do you treat it? Which one? Which one for iodine? It is eye treatment for prostate cancer. If you use iodine, it is which one? I-25, right? किसी को याद आ रहा है? Yes, I-25. And the metastasis, another question that is asked, I-25. The other question that is asked is, metastasis is direct to the vertebrae. Vertebrae, ठीक है? Alright, GCS score. Yes, I will do GCS also. That is also important. So, breast cancer, lung cancer, osteoblastic and osteolytic, these are the markers. Okay, beta HCG for choriocarcinoma, calcitonin, I already told you, medullary carcinoma. And then we have catecholamines, which are increased in pheochromocytoma. What is the triad of your pheochromocytoma? It is headache, palpitations, and sweating, right? And then you have AFP, which is increase in hepatocellular carcinoma, yolk sac tumor. Colon carcinoma has increase in CEA, and then neuroblastoma, neuroendocrine tumors, NCE. PSA is increased in prostate. CA 125 ovarian, CA 19.9 pancreatic, and 15.3 breast cancer. These are important. Many times they ask the question, okay? And this is on this thing, okay? Seminoma is non-AFP, right? Nothing increases. No, AFP does not increase in seminoma. Go through this. Gist maltoma, again important, right? These are your hypersensitivity reactions. How do you remember them? ABCD. आज याद कर लेते हैं. Let's remember this and let's not forget this, okay? Till the exam. Exam के बाद I told you ना, दारू पी के बंद होके एक जगह बैठ जाना. Okay, so look at this one. Type 1, what is it? ABCD, allergies, bronchial asthma. Then you have what? C is for Kasuni's test and D is for drug eruption, like a drug, that is penicillin. Penicillin, it is considered type 1. And I also told you atopic dermatitis, right? Atopic dermatitis. That is also type 1. Guys, are you still with me? ये सब भाग गए हैं. Are you still with me? Yes. Okay. 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 So type 2 is my blood group is अरे आ ही रहा है चैंटिंग नहीं जा रहा कहीं पर भी. Okay, don't worry Sanjay. Okay, type 2 is what? My blood group is Rh positive. What is M for? Myasthenia gravis. But remember, myasthenia gravis is more considered type 5 than type 2. Okay? Okay, more than type 2, it is type 5. Okay? Then blood transfusion, Graves' disease, good pastures, ITP, which is immune thrombocytic purpura, okay, and your positive is pernicious and pemphigus. Just go through this. This is type 3, which is basically type 3 has vasculitis, okay, which is cytotoxic. Type 1, type 2, type 3, type 4. Cytotoxic. Cytotoxic. Yeah, sharp. So anything, vasculitis, basically vasculitis, okay. Think of vessels when you think of type 3, right? So type 2, yes, cytotoxic is type 2. Nahi, more is type 5. More is type 5, okay? More is type 5, then type 2, right? Yes, everybody is ready for Maha chanting. And these are your disorders like autosomal dominant, X-linked. So just go through this, right? Just go through this, and I think we will end क्योंकि अभी time हो गया. You can take rest and you can come back later. GCS, somebody told me, remember it is GCS is EVM 456. Okay, GCS is EVM 456, right? So one for eyes, it is, remember the least score is 3, okay, and for eyes it is what? You can give 4 for what? If the patient comes to you, like you go right away to the patient and the patient opens their eyes, so spontaneous eye opening, that is 4. 3 is for verbal, like you speak to the patient and they open. 2 is for pain and 1 is for no response. So 1 is for all no responses. Then 5 is your, which one? Yeah, very good, verbal, right? Verbal. So 5 is which one? Oriented to time and place. Oriented to time and place. Time, place, where I am. Then that's, so you will do an examination, right? Then 4 is for this patient is disoriented, right? Kind of confused, okay? Confused verbal response. Then 3 is for, anybody can tell me what is 3 for? Words, yes, very good. Words. 3 is for words. 2 is for incomprehensible sounds. Now this patient is just making so incomprehensible sounds. Okay. And 2 is, 1 is again no response. Then you have 6 for mechanical, muscle, right? So what is the first one? Okay. So with this, let's end this. Okay, with this, let's end this. Just go through EVM 456. So GCS always comes. Apgar is what? Apgar kya hai? Come and meet me whenever you go. Yeah, spontaneous. Then there is, remember, flexion comes before extension. Okay, flexion comes before extension, right? So thank you for all this. Apgar is appearance. Then P is for P, G is for grimace, A is for activity, and R is for respiration. Okay? Thank you for boosting us till now, 7 months. Yeah, very good. Thank you. You are also very cute. Must appreciate. 3 is for, yeah, inappropriate words. Yeah, that's what I said. 3 is for inappropriate words. Incomprehensible sounds is 2. Okay? So, best of luck. I will come back giving you best of luck again क्योंकि वो हमारा काम है. हम आ जाते हैं मुंह उठा के ऑनलाइन. ठीक है? तो yeah, pulse. P is for pulse. ठीक है? So, thank you every point to be noted. Okay? And thank you for coming and staying with me and listening to me and being with me. I will remember this always. Thank you. I really like when you guys come over and we get to study together. So बहुत अच्छा लगता है ना? And I just pray and hope and I pray more that you pass. Okay? So if you can give me a feedback, personal feedbacks, I have this thing where I save all the words. I have this thing for words. I have a gallery, my own gallery where I save all the words because I'm a nerd. You can see glasses. तो मैं बहुत पढ़ती हूँ. So any time when I get depressed, I read your words. Okay. So if you feel like, please send me a feedback personally. That would be very happy for me. And let me know about you. Let me tell your story to me if you have time. Because अब वैसे भी क्या क्या कर सकते हैं. ठीक है. तो जब तक क्लास लेना है लो, बाकी just go through. Okay. And see you next time. See you soon. We will see you tomorrow. क्योंकि हम आ जाते हैं मुंह उठा के. I told you, right? So take care. Bye. I love you. PDF I will send before I leave. ठीक है. So this is the whole PDF of the mixed bag images, right? So I will send this. Okay, Jabi bhi, when you come to Delhi, please do meet us. Please meet us. ठीक है? Take care, guys. Bye. Okay? Bye. Take care. Once before we leave, I will pass. I will pass. अब की बार 200 बार. अब की बार 200 बार. Okay? चलो. I'll just send this PDF. Okay? Bye, bye, bye.